May 7th, 2017, Carlisle, Ohio. 18-year-old varsity cheerleader Brooke Skylar Richardson gave birth at home and buried her newborn daughter in the backyard of her parents' house. 2 months later, she described what had happened to her doctor, who informed police. Richardson was ultimately charged with aggravated murder, child endangerment, involuntary manslaughter, and abuse of a corpse. Today, we look back into this case and deep dive into the investigation, the testimony, and the verdict. Ultimately, we ask the question, was justice served in this case? Today, we find out together. This is BETHEA'S BYTE Reloaded Throwback, Ohio versus Richardson. And it begins right now. And a good Monday morning, Monday early afternoon, everybody. Welcome to BETHEA'S BYTE Reloaded Throwback, Ohio versus Richardson. This is the 8th installment of this case, and it is so good to have you here. Good, I'm glad you want to spend part of your day with me. I'm Ernest Bethea, the Last Outlaw, and today the defense begins presenting its case as the prosecution is already rested, and the defense will present their case beginning with an OBGYN expert. That expert being Dr. John White. So, before we get started, a little house cleaning as always. First of all, I want to thank you all for joining me. I want you please be sure to like, share, subscribe, and comment. And liking the video is a free way to help the channel. If you would like to join the open panel, please go right ahead. Click on the link, copy it, put it in a new browser tab or window. More than happy to have you. For everybody that'll join in the chat, everything you comment, a statement you make, on all your views, it is seen as speculation, deduction, theory, and opinion. They will not be considered as evidence or fact. Your opinions are welcome. Attacks against other chatters are not. If you don't like an opinion, click on the 3 dots, click on block, and you're good to go after that. Please be sure to have respect. No racism, no homophobia, no attacks on other chatters. We're not talking politics or religion unless it's absolutely necessary to the case. All right. Here's the copyright disclaimer for fair use. And here's the trigger warning. Everything you see in here, it may be triggering to your mental health. And if it is and you can't take it, please turn away. What you was about to see here is courtesy of Court TV and Front Row Seat to Justice, and I shout out to all of them from top to bottom. You guys do such a great job. All right. Without any further ado, let us. Oh, Dippy, how you doing?
Can you hear
Hey,
me?
Dippy, how you doing?
Can you hear me?
Loud and clear.
All right, I'm good.
Loud and clear.
How are you doing today?
Great. I'm doing just fine. I'm about to get set to start this testimony off.
That's good. I've been thinking about re-going over this case too. I'm glad somebody else is looking into it.
Mm-hmm. Oh yeah. This is one of those cases that's been like, wow. There's so much there's been so much that's been said in testimony, so much that's been shown in the interrogation video, but the one thing we can say for sure is that either in the courtroom, in the interrogation video, Brooke Skylar Richardson is as nervous and as scared as a little bunny rabbit.
Yeah, so you could tell this is her first time ever having to, be interrogated.
Deal with something like this.
Yeah, and I mean later on after you do this, I'll give you my opinion on it, but I don't want to go too far into it since you're just doing it now like this. But I followed this case like extensively.
You got it. All right, ladies and gentlemen, let's go right into the courtroom. This is like I mentioned. This is the beginning of the defense presenting their case, and about to go on the stand now is Dr. John.
Morning, Dr. White. Could you please tell the ladies and gentlemen of the jury your full name and your professional address?
Yes. My name is Dr. John E. White. 24. The address is 723 Auburn Avenue, Cincinnati, Ohio, and I practice at Mount Auburn OBGYN Associates Incorporated.
You also have an office in Warren County, too?
We have an office in Mason, Ohio at 608 Reading Road.
Doctor, you're a medical doctor, is that correct?
That is correct.
What's the nature of your specialty?
Obstetrics and gynecology.
Can you tell the ladies and gentlemen of the jury a little bit about your educational background?
Yes, I did my undergraduate, my medical school education and residency all at the University of Kentucky in Lexington, Kentucky. I graduated from medical school in 1984, and I finished my residency in 1988, and I'm from the Cincinnati area, and I moved back home to practice obstetrics and gynecology in Cincinnati in July of 1988.
And you are currently licensed to practice in the state of Ohio?
That is correct.
And since when were you licensed to start practicing in Ohio?
Well, I made sure I had my license in force when I started practicing in July of 88. So I have been licensed since July of 1988.
And are you board certified?
Yes, and the board is the American Board of Obstetricians and Gynecologists. That's the board for our specialty.
And what does that mean to be board certified?
Well, what it means is that you've distributed competence and a level of ability and education that the American Board requires to allow you to practice obstetrics and gynecology. And it used to be a two-step process. You used to have to practice your written boards before you began practice and passed those. And then after being out in practice for 2.5 years, you had to go to Chicago and take an oral exam to pass your oral boards to continue to be board certified. And then in 2000, they decided to require you to be recertified every 6 years. And then in about 2012, they changed it, and I have to be recertified every year by continuing medical education and taking exams and that type of thing online at home. So I've kept my board certification up since then.
Are you affiliated with any hospitals?
I have privileges right now at the Christ Hospital in Cincinnati. Over the years, I used to have privileges at Bethesda and Bethesda North, but I decided to, just because of the driving back and forth with I-71, decided that was too stressful, so I limit my practice to Christ Hospital in Cincinnati. I have retained courtesy privileges at the university just in case we have a preterm delivery. Excuse me. We help educate the UC residents at Christ Hospital in OBGYN, but I really haven't done any work there. So for the most part, 100% of my professional practice activities is at my offices and at Christ Hospital downtown.
When you say the traffic on I-71, just so that the jury understands, they heard that you have a practice or an office in Mason.
Yeah, mainly emergencies, delivering babies in the middle of the night, but I do drive up to the Mason office at least once a week to see patients.
And your actual home is in northern Kentucky.
Yeah, I live in Fort Mitchell, Kentucky.
Have you served on any medical boards?
Well, now are you talking about work-related or outside of work?
Work-related and or outside, as long as a medical board.
Well, at work, I've been chairman on numerous committees throughout the years, and I served as a review committee for malpractice suits with a medical malpractice company, Pro Assurance, and then outside of work, but still in my profession, I served as board chair for the New Hope Center, which is a Christian-based nonprofit pregnancy crisis center in northern Kentucky.
Are you a member of any professional associations or organizations?
A member of American College of Obstetrics and Gynecology, commonly called ACOG.
Have you testified previously in any case as an expert?
Yes, I have.
How many times?
Deposition and trial total probably about 15.
Okay. And what type of cases were you involved in?
Those were all medical malpractice civil suits.
And were you testifying primarily for the defendant doctors?
Yeah, the vast majority of them have been defending the physicians. I've probably reviewed about 60 cases. Over 90% have been for the defense, but I have reviewed probably 5 to 10% for plaintiffs. And I've also reviewed some cases for the U.S. federal government downtown where physicians either employed by the military or somehow connected to the federal government have been sued.
And you're, I assume, testifying on behalf of the physicians being sued?
On those federal government suits, I've been, yes, asked to review cases and give my expertise on cases that their physicians have been sued.
Have you ever testified before in a criminal case?
No, I have not.
And have you always been qualified, called upon as an expert in your field?
Yes.
May I have his? Yeah, approach, Your Honor. Dr. White, I'm going to hand you what's been marked as Defendant's Exhibit A, B, B, and A2. You just look at those very briefly for me, please.
Okay.
You've had a chance to look at them, and just briefly for the jury so they understand what they are, what are these three documents?
Excuse me. The first one is my opinion My report dated February 7th, and then the second one is a supplemental report dated March 20th that I prepared after I reviewed some supplemental items, and then the third was my curriculum vitae.
Thank you. Now, doctor, in your practice, can you describe what you do as an obstetrician gynecologist?
Well, we, from the obstetrical standpoint, we follow patients before they're pregnant, and then when they get pregnant, we confirm their pregnancy, and then we provide prenatal care, and then we deliver their babies, and then provide the postpartum care afterwards. Pretty much all-inclusive, and we address medical issues that come up along the way, and we are trained to manage some of them, and some of them we need to consult out. But we're full care of the pregnant patients. From the gynecology standpoint, it's really from about ages 18 through 85. We provide well care to women, and also specifically for gynecologic issues and breast issues over the years of their life.
Doctor, approximately how many babies have you and your group delivered in the last 30 years?
Well, I am a person, I never exactly kept track. Some doctors have kept track of every delivery. I haven't. To estimate, I would say in my private practice, which is again since July of '88, 31 years, averaging 150 to 175 a year, so that's close to 5,000. I've always been in a fairly large group, and we've delivered about 800 to 1,000 a year, so I've cared for probably about 30,000 in that time frame.
And when you say large group, you're talking about
5 or 6 OBs at share call.
Approximately how many babies have you delivered that were stillborn?
Probably in 31 years of private practice, I would roughly say about 100.
Doctor, is intrauterine growth restriction a condition that affects expectant mothers?
Yes, intrauterine growth restriction, or what we call IUGR, is something we are always watchful for and screen for in all of our patients. It affects 10% of all pregnancies and is a leading cause of what we call perinatal, which means before birth and after birth, morbidity, which means bad outcomes, and mortality, which means death. So it's one of the big things we follow the pregnant patient for.
How is growth restriction discovered in your practice?
Well, when you, again, you're seeing your patients every 4 weeks early in the pregnancy, every 2 weeks after 32 weeks, and weekly after 36. And as part of the normal exam, you're screening for risk factors, you're weighing them every time they come in, you're taking their blood pressure, you're assessing their overall health, and then in every patient, you examine the patient, and in every patient after 24 weeks pregnant, you measure what is called a fundal height with a tape measure, and you measure the fundal height in centimeters. And we do that at every visit, and a fundal height lag is indicative of that they may be having a problem with IUGR.
And I take it that when you're measuring your patients, almost all the time, you have some idea of when conception occurred. Is that correct?
The most important thing that obstetricians actually do at the initial visit, I would say it's twofold. Number one, confirm that indeed they are pregnant. I'll give you 3. Number 2, make sure the pregnancy is in the uterus and not in the fallopian tube or an ectopic. And number 3, estimate their gestational age. Because it's the gestational age, which means then calculating their due date, that all your other decisions will be predicated on. So the first thing we do when we see the patient is we ask when their first day of their last menstrual period. Some know, a lot won't know. And when I used to teach the residents, I said, ask every single patient when the first date of their last menstrual period is, then ignore them and get an ultrasound and figure out how far along they are so that we can calculate the due date.
And part of that is also using the fundal height measurement.
Well, early on, in the first trimester, it's by ultrasound exam and pelvic exam, and then the fundal height measurement for growth is done beginning 24 weeks of pregnancy.
Thank you. And Dr. White, you're here today to give us your opinions based on your review of records, reports, interrogation transcripts, and interrogation tapes, Skylar's OB records and the like. Is that correct?
That is correct.
And Doctor, before we get into the basis of your opinion, based on your education, experience, and background, do you have an opinion to a reasonable degree of medical certainty as to whether Skylar Richardson gave birth to a stillborn on May 7th?
Yes.
And what is that opinion?
That indeed, early in the morning on May 7th, at home in her bathroom alone, she delivered a stillbirth infant in the bathroom, in the toilet, at approximately 3 a.m.
And can you tell the ladies and gentlemen of the jury what you're basing that opinion upon? What did you review to come to that?
Well, I reviewed my opinion on numerous records I got that go back even to Skylar's children's hospital care, where she was being treated in the adolescent medicine clinic for her eating disorder. I also reviewed her high school and middle school records, looking for a health history, and the health history would include psychiatric disorders like anorexia, bulimia, and other eating disorders. I reviewed the Hilltop OBGYN records that I received from her visit with Dr. Andrew on April 26th and Dr. Boyce on July 12th. I reviewed the records from the report from Susan Allen, the deputy coroner, regarding the coroner's report. I reviewed Elizabeth Murray's forensic anthropology report dated September 6th, when she reviewed the remains of Annabelle and gave her report. I reviewed various email communications on September 27th, 28th between Mr. Knippen and Elizabeth Murray and Professor Latham about the forensic pathology. I reviewed a report of, I believe, a gentleman who will be called by the defense, Mark Levon, his report on the forensic pathology of that. And then also, very importantly, I reviewed probably 5 or 6 times at a minimum the interviews with on July 14th between Detective Fain and I believe it's Catherine G.E.E., when they interviewed Skylar on the 14th after they were notified by Dr. Andrews' office of the delivery, and also the interview on July 20th between Detective Fain and Detective Brandy Carter when they interviewed Skylar on the 20th. I reviewed the police report, including the interview with Mr. Trey Johnson, and I interviewed the DNA report that confirmed the parentage of Annabelle. I may have left something out.
As a result of your review of these records, can you tell the ladies and gentlemen of the jury what facts support your opinion? Your opinion that Annabelle was born stillborn?
Okay. Well, you don't care if I
You
go
just,
on a
you just
while.
answer however you have to answer it.
Okay. So initially we know going into the pregnancy that Skylar has a long history of an eating disorder. Her weight had bounced around quite a bit. In February of 2015, there was a little crisis with her eating disorder. She had lost weight. Her friends were worried. They contacted her mother, and her mother took her in to see a specialist at Children's Hospital. At that visit, she weighed 103 pounds and was 5'2", and they ordered her labs, and just because of the vigor of youth, her labs were pretty much normal. But the doctor worked with her, and as they do, and it's my psychiatric rotation at the University of Kentucky was in the inpatient eating disorders unit, and so I can speak to how challenging these problems are with the patients and their families and the doctors, because this can be a fatal disease. And people, I think everybody's heard of Karen Carpenter. She died of anorexia. It's a very serious medical problem. But anyway, that being said, she did well. That was spring of her sophomore year. She did gain weight. She went through junior year. I didn't see much to really talk about during that period of time. And she was ready to start her senior year at Carlisle High School, took a sports physical. And at that physical, she weighed 134 pounds. She had a normal blood pressure. Her physical exam was good. Her weight was back into a normal range, and that exam took place on September 13th. And that's important because it's easy to say that was her pre-pregnancy weight. And some of this is out of order the way I found it, because I'm giving you a chronological order of her pregnancy and not necessarily how I found out the information. But what we do know, due to the interview with Trey Johnson by the detectives and by the DNA results, that 99.9% sure that Trey Johnson was the father of the baby, that sometime between July 24th of 2016 and August 7th of 2016, Skylar and Mr. Johnson were involved in some relationships, as teenagers do, and a pregnancy occurred. And so when the conception occurs at that point, when you're figuring out the date of the pregnancy, you would actually back it up 2 weeks, because the pregnancies are calculated from the first day of the last menstrual period, and then you calculate out 40 weeks. As obstetricians, we have a little trick. We can do it in our head real quick. It's called Nagel's rule. You subtract 3 months and add 7 days. So the latest she would have conceived is August 7th. If you subtract 2 weeks, the first date of her last menstrual period would have been July 24th. That would give her a due date of June, May, April 24th, May 1st of 2017. So I knew her due date by that information was approximately May 7th, which actually, if you look at the forensic anthropology report of the femur length and the measurements of all the bones, when they gave a range of 38 to 40 weeks, the femur length, which is what I use because that's what we use clinically with our ultrasound dating, her femur length was consistent with her conception date, which we knew from Mr. Johnson, confirmed by the DNA, and we knew her pre-pregnancy weight on July 13th of 134. Well, she got busy with her school year. She dropped out of cheerleading. She never saw a doctor for her pregnancy. She was not on any birth control when she got pregnant, and had not yet seen an OBGYN, and was finishing up her senior year, and went in to see Dr. Andrew on April 26th, 2017, for what he thought and she thought and everybody thought, but what Skylar was suspicious wasn't for, because Skylar held out some suspicion that she could be pregnant, but she went in, as often the times with his age group, to begin birth control. Dr. Andrew, like we all do, examined her, realized really quickly she was pregnant, realized really quickly she was in the 3rd trimester, and actually did a fundal height measurement at that visit and measured to be 32 centimeters, which a fundal height, just by coincidence, but a fundal height measurement is equal to the weeks of gestation plus or minus 3. So he estimated her to be 32 weeks gestation on April 26th. So it was his belief on April 26th, and it was probably conveyed to Skylar that she was about 32 weeks pregnant. It was too late for her in the state of Ohio to have an abortion. She panicked. She told her, "You can't tell my mother this." Her mother was waiting for her out in the waiting room. She left the office, and Skylar probably thought she had some time to figure out what.
The objection is sustained. Ladies and
Okay.
gentlemen, the purpose of this witness is not to provide you with factual information
Okay, I'm sorry.
with regard to what happened. The purpose of this witness is to explain to you what facts he used in reaching his conclusions, and then you are to determine whether or not those facts have been established by direct evidence. So the objection is sustained. Mr. Richter, please rephrase. The jury will disregard the last answer.
Well, Your Honor, I would like for him to continue what he relied upon and what were the relevant facts, as the court just pointed out. And
He can indicate the things that he relied on and cite that source material, but he is testifying as if they are facts, and they are not.
well, fair enough, Judge.
All right, go ahead.
I can tell you,
I think I understand
All right.
what, and I think I could. So,
let me stop you for 1 second, though, Dr. White. Dr. Andrew came in here at the beginning of this trial and told the ladies and gentlemen of the jury that after he took the fundal height, that he told Skylar that she was going to deliver a baby within 10 weeks. Just, does that help you in any way?
yes, that would be appropriate, given his estimation of her gestational age on April 26th.
Gotcha. So, what other facts did you rely on to come to your opinion that Annabelle was stillborn?
The facts that I relied on to tell me she was stillborn was the description of the delivery in the July 14th interview with Detectives Fain and G, and the description of the deliveries in the interview July 20th between Fain and Brandy Carter. And also what I think I can say, and I'm sure I'll be stopped if I can't, but the 32 centimeter fundal height, I had the retrospective ability to know that that was markedly abnormal, because at the 26th week visit, based on the facts we knew, she was not 32 weeks. She was 39 to 39 and a half weeks, which meant that her fundal height at that visit was lagging by 7 centimeters.
If I may have 1 second here. Can I have the police report first, please? Doctor, this has been already made known to the jury. This is part of Detective Carter's police report, where she talks about the fact that she and Lieutenant Fain went to see Trey Johnson, who we now know as the father. And in her report, she says, may I have a highlighter, please? You got me there. It's, oh, I see what you did. So on the, just so the jury isn't confused, I'm using two pages here. On the first page, sorry, it's okay. starting right here, they are reporting in this report what Trey Johnson said. He stated that they talked and did stuff for about a week in late July or first week of August. And then the next week, she suddenly blocked him on all social media, and he has not spoken to her or seen her since. Okay? Is that a very relevant fact to your opinion that you have given the ladies and gentlemen of the jury today?
Yes, I relied on this information to give me a conception date, and it also corroborated what I knew from Murray's forensic pathology report to allow me to estimate her due date.
So, may I approach? I'm going to hand you, we marked these, but I don't think they'll have to go back to the jury. I'm going to hand you two calendars. One is dated 2016 and the other is dated 2017. If you would, could you, based on Trey Johnson's interview and statements to Detective Carter, can you show the jury, using a calendar, how you would come up with the idea that the Annabelle was 39 weeks along when Skylar visited the OB, meaning Dr. Andrew, on April 26th?
Okay. Well, the first week of August, the 1st through the 7th was a Sunday, so that's when I used at the latest that Annabelle would have been conceived. I then went backwards 2 weeks, which would have been July 24th. And there's a lot of ways to do it. You can count in your head, or you can count down the calendar 40 weeks. But the way we do it quickly is we back up 3 months and add 40 days. That's approximately 40 weeks. That would give you June, May, April 24th, or May 1st of 2017. So I knew that the estimated due date was May 1st, which would have been the Monday before she went into labor and delivered. And her visit with Dr. Andrew was on April 26th, which was the week Wednesday before there, about 10 or 11 days before due date. So if she delivered on the 7th and her due date was the 1st, and her visit was the 26th, which was 11 days before she was delivered, that's only 5 days before her due date. So she would have been 39 weeks and 2 days, or we would just approximate 39 weeks when she saw Dr. Andrew.
Dr. White,
Is there a way to get that off? It might have hit something.
I think you cleared it.
Display the picture. It's stuck. It's just stuck. It's not that. That's clear.
My guess is you need to restart the presentation device. Presentation mode. and then back.
His monitor went off as well. I don't know if that's related.
The only thing I do is I just go back to reboot the system because I turned it off.
So we turned that off completely?
Yeah, it's off right now. It's stuck in the mixer back there, so I need to reboot the mixer.
Okay, we'll wait.
Okay.
May we approach, Judge?
You may. Out. Ms. Yezel, if you could take the jury, return them to the jury room. Hopefully, this will not be a very long break.
Okay, it looks like we're about to go into either a break or a sidebar, and I want to indicate, as you can see from this shot here. I know I've said it many times over, but it bears repeating. Take a look at Brooke Skylar Richardson's face. Deer in the headlights doesn't begin to describe the look on her face. This young lady is scared to death. It's like she looks like she wants to continually ask herself, how in the world did I get here? How did I get here, and how do I get out of it? Right now, she's literally in the fight for her life, and we'll find out if the jury either sympathizes, or will they literally condemn her for everything that she's charged with. And by the way, in case you missed the intro, her charges include aggravated murder, child endangerment, involuntary manslaughter, and abuse of a corpse. Let's go back to the courtroom.
You can be seated. Yes, I mean, I'm going to stay here so that I can maybe troubleshoot some of the technical issues, but we're on break. So, Doctor, you can step down. At the,
Yeah, it's, okay. Let me shut down.
we're back. We think that we have resolved our technical issues. Mr. Richters, you may continue.
Thank you, Your Honor. Doctor, I think you left off at the facts that went into support your opinion, correct?
Correct.
Doctor, I'm going to show you two pictures. They're side by side. And it's marked as Defendant's Exhibit, it's like 0025. Have you seen those pictures before?
Yes.
And did you Did those pictures have anything to do with your opinion?
I certainly use them as a piece of the puzzle, and I found them concerning. You can see on the February 15th photo in Columbus that was obviously taken at the store, because you can see the things in the background, but you can see that Skylar is pregnant, and she's in her tight-fitting dress, and you can see a little baby bump there. But then when you compare it with the May 5th photo, I see very little difference in that. She still fits in her dress. To me, it doesn't look like she's put on any fat at all. Her breasts aren't at all bigger. Her arms aren't at all bigger. Granted, it's just one photograph, but I think at looking at her abdomen, looking at her dress, she doesn't look like she's gained any weight.
Doctor, exactly what was it in the interrogation videos and transcript that you reviewed that convinced you that Annabelle was stillborn?
Skylar, in her first interview on July 14th, I thought described, without any scientific knowledge of what a baby would look like, but she described a stillbirth that, from my perspective, when I've delivered stillbirths, what they are, and by definition what they are, which she described at least 20 times in one way or the other, that Annabelle was not breathing, she didn't see any movement, her eyes remained closed, and that when she held her, after she delivered her in the toilet, she squeezed her, and she was trying to see if she could feel or recognize a heartbeat, and she saw none. And then, on the 20th, early in that interview, she described Annabelle's appearance as being really white. And in my experience, when you deliver a healthy newborn, they're almost purple. They haven't yet pinked up because they haven't breathed any air yet. They're getting their oxygen through the placenta, and they almost have a blue to purple appearance until they let out that first scream. And also the other thing is that in that 20th interview, she remarked how the baby just plopped out of her. And it's been my experience in delivering stillbirths over the years, when they've been dead and died in the uterus, their skulls start to collapse, and the nurse will actually call us to the delivery room sooner than they may for a normal delivery, because it becomes a very unpleasant circumstance to have the mother just plop out of stillbirth in the bed, and they want to make sure the obstetrician shows up. And then additionally, and again, she would have had no knowledge of this, the fact that when she delivered in the toilet, that cord just snapped in two and was separated from the placenta, which she delivered sometime after. When we deliver a stillbirth and we're trying to deliver the placenta, usually when we deliver the placenta during that stage of labor, we can put a little bit of traction, or we pull on the cord. But in a stillbirth, the cords are very narrow. They don't really have the substance in them that gives them that tensile strength. It's called Wharton's jelly, and if you pull on it just a little bit, it'll snap right off the placenta, and that can cause a problem. So I think that kind of summarizes what I found. I may have left some things out.
You used the word snap. She didn't say snapped in an
It just
interview.
came apart.
She didn't.
It wasn't.
She didn't have to cut it.
Right. The baby was attached to the umbilical cord, which was up around the neck or shoulder, but it was detached from the placenta, which was still in her uterus.
Doctor, I'm going to show you what's been marked as Defendant's Exhibit EEEE. What's that? What is that picture of?
That is a fairly healthy, typical, brand new newborn that you can see his face is a little bluish purple. Hands are still a little bluish purple, starting to pink up in the midsection there. The cord has been cut. You can tell he is, especially on his feet. Notice the tone of his feet. He's starting to really get a lot of tone. He's got he or she, I don't see the genitalia to be honest, but got a grimace on the face and a good lusty cry. Because when babies deliver, it's even before they really need oxygen yet, but the reflex of babies when they deliver, it's one of the miracles of birth. They almost startle and start out with a very lusty cry if they're well oxygenated and ready to breathe that room air. And then once they take the big breath in, then that opens the lungs up, and then they just start wailing.
And if the baby's white, as Skylar described it in the interrogation, what does that mean?
It means that there has been no oxygen exchange for a period of time from the mother through the placenta, through the umbilical cord to the baby, so that the prior to death, the fetus has essentially used up all the oxygen, and it has that, everybody's familiar with the pallor of death.
Dr. White, prosecutors hired Dr. Kim Brady to critique your opinion, and I provided you with his reports, did I not?
Yes.
And you had a chance to review those, right?
Yes.
And when you reviewed them, you had a chance, I take it, to review his summary, where he says, one cannot conclude based on the review of the aforementioned records that Miss Richardson's fetus was growth restricted and or stillborn. What's your response to that?
I disagree with his conclusions and came up with a different conclusion based on my review.
Did you see anywhere where he mentioned anything about anemia or nutritional insufficiency, or did he consider that in his reports that stuck out to you?
He did actually comment on the lack of evidence for anemia and used that as part of his rationale.
Okay, hang on one second. Doctor, I believe when he came in here and testified to the jury, he was referring to the Hilltop Obstetrics Group records. And these are the records of Skylar Richardson when she first went to see an OB on April 26. And I'm going to show this. Does this look familiar?
Yes.
And is that the results of the blood that was taken from Skylar?
Well, part of it is at the top, they did the toxic drug screen, which allowed me to conclude that nothing happened was due to any drugs she was taking. There's a urine test there that showed she did not have a urinary tract infection. The bottom of the page, it shows she did not have any sexually transmitted diseases.
It showed you the wrong page, but I'm glad you went through that for us.
I was waiting for you to get there.
Apologize. Doctor, you recognize that?
Yes.
Tell the jury what that is.
Again, these are routine initial prenatal labs we do on every prenatal patient. This page includes a syphilis test, which was non-reactive, meaning she did not have syphilis, rubella that shows she didn't have rubella, or she'd been immune to rubella, more specifically, and then not have hepatitis, and then down, as you scroll down, it starts with her white blood cell count, red blood cell count, hemoglobin, hematocrit, and it goes on down the page.
So in that report, I think Dr. Brady indicated that she didn't have anemia, so he believed that there was no nutritional component related to this pregnancy.
Yes, he looked at the hemoglobin, hematocrit, which were on the lower end, but I agree with him, they were still in the normal range.
Could you circle that for the jury so they know what we're doing?
Blow it up for you, Doctor.
Those two right there, the hemoglobin, hematocrit.
Okay, those two. So,
Will my pen work on this?
I'm sorry?
Will my pen work on this, or does it need my finger?
You need your finger.
Okay.
Is there, Judge, is there a stylus that he could use?
It'll be fine, we'll try to. But as I scrolled down, and the labs, because I don't want us doctors to miss things, so that's not good to miss things. See right there, that's an abnormality. And to the left, it says 16.2% with a normal range of 9 to 15. RDW, and I understand how he missed it. It's not something that we routinely do, but I thought that this was very interesting in that, because what I did is I went back to when she was at her lowest weight of 103 in the adolescent clinic with a doctor where her mother took her in, where her weight was down to 103, and compared these results. And on that visit, the RDW was 12.1. So this was an abnormality. And what RDW is, it's an abbreviation for red blood cells, which makes up the oxygen carrying of your blood, that you need iron and folate and B12. The RDW is the red cell distribution width, which essentially means the size of your red cells. And when your red cells are all different sizes, that means your bone marrow is putting out these red cells to get them into your peripheral circulation as fast as the bone marrow can.
And why would the bone marrow do that?
Well, because if the bone marrow is trying to keep up with the oxygen needs, the blood needs red cells. So she is compensating, but barely so. And so what the red cell distribution width is telling us is that she's in a nutritional iron and B12 and folate deficient state, and she's just barely hanging on to that normal. So I agree with him that her hemoglobin and hematocrit were normal, but where I disagree with him is saying that this blood cell CBC result is evidence that she was not in a nutritional deficiency, especially when you look at the other factors or poor maternal weight gain, et cetera. So I disagreed with the fact that he concludes she wasn't in a nutritional deficiency just because her hemoglobin hematocrit were still within the normal range.
Thank you. Dr. White, Dr. Brady came in here and told the ladies and gentlemen of the jury that as to fundal height and its reliability, when you obstetricians take fundal height measurements every visit after 32 weeks.
24 weeks.
Thank you. After every 24 weeks, that it's only accurate 40% of the time. Do you agree with that?
No.
Doctor, I went through this with Dr. Brady, but I'll ask you, what is ACOG?
ACOG is the American College of Obstetrics and Gynecology, and they are the national organization that helps obstetricians maintain their expertise, maintain the quality of medicine, and one of their roles is routinely putting out publications. They put out a journal, they put out practice bulletins, they put out task force, so that we review these so that we can keep current.
And when you say keep current, so keep current as to the standard of care?
To the standard of care of medicine. Things change, so no matter how good our education is, you know, if you don't keep up with the newest and the latest, you're going to fall behind very quickly. So ACOG is our national organization that provides those, for a fee, provides those services to us, and we become members of ACOG, and then we have access to these things that are paper and now a lot of online.
And so these practice bulletins that are published by ACOG, and you and Dr. Brady are both members of ACOG, right?
Yes, we would, we would rely on this information to shape our practice and also to reinforce that the way we're doing things is still current and the standard of care.
So simply put, it is relied upon by all obstetricians and gynecologists as to it's relied upon as state-of-the-art medicine.
Well, I won't say all, but vast majority, so that we can still provide health care as safe as we can.
I'm going to show you what's been marked as Defendant's Exhibit KKKK. And obviously, it's one of the practice bulletins. This was also shown to the jury when Dr. Brady was testifying here today. The very top there, this is one of those publications by ACOG, correct?
Correct.
The date of this particular bulletin, it looks like it was reaffirmed, and I'm talking about, I'll circle it, 2018, but it first was published 2013. Is that correct?
Correct. And it also point out that it's done periodically because the May 13th bulletin replaced the practice bulletin from January 2000. So this has been something that, you know, the understandings of IUGR, they title it fetal growth restriction, is not new.
Gotcha. But the point I'm trying to make is that this being reaffirmed here means that as recently as last year, what we're about to read here and what you're going to explain to us.
And also current. Reaffirm means they republished it without any significant changes.
Let's go to the next page. Next page. All right. Top part. Doctor, there are several places on this particular page of this publication that I'd like for you to explain to the jury, if you don't mind. The first part, if I may, its section is titled Screening for Fetal Growth Restriction, and I've highlighted the portion that I want you to discuss. If you don't mind, would you mind reading what I've highlighted there, please, so that the jury can not only see it up there, but they can hear it from you.
Fundal height measured in centimeters between 24 and 38 weeks gestation approximates the gestational age and is used to screen for fetal growth less than or greater than the 10th percentile. A single fundal height measurement at 32 to 34 weeks gestation has been reported to be approximately 65 to 85% sensitive and 96% specific for detecting growth-restricted fetus.
Okay. So tell us what that means.
So fundal height, the way we do it is we take a tape measure and we measure from the top of the pubic bone to the top of the uterus, which is called the fundus. And as I think I mentioned before, it's just a human coincidence that that fundal height measurement approximates the human gestation in weeks. So 32 centimeters, 32 weeks. However, due to human variation, there can be a variation. Where they use this is that you want to detect those fetuses that are in the lower 10th percentile, which means they're smaller than 90% of all other babies that gestational age, because it's the small babies that are at risk for intrauterine death. And sometimes I've explained to my patients, it's not like going out to the pumpkin patch and picking the biggest pumpkin for your jack-o'-lantern. We're going to let the big pumpkins grow. We're going to pull out the little pumpkins because they're going to die on the vine. So one of the most important things we do as obstetricians is monitor for IUGR. And this is the way we clinically do this, by a simple tape measure of the fundal height. And if it's more than a 3 centimeter difference, then we become concerned, and also looking at other risk factors that this baby could have IUGR. And also importantly, as they say, greater than the 10th percentile, because you want to tell the normals they're normal. So sensitivity, 65 to 85%, means that fundal height measurements will pick up 65 to 80% of those babies that are beneath the 10th percentile using that single fundal height measurement. And specificity of 96% means that those mothers that are normal at that measurement will not have IUGR.
Now, we're going to go on down the page.
Dr., if you touch the lower left part of the screen, it'll clear off all your marks.
So the same bulletin, this practice bulletin, we're going to look under this section, same page. Clinical considerations and recommendations. This is what they're recommending to all you obstetricians and gynecologists, correct?
Correct.
Could you read that first paragraph for us and explain that to us?
So they asked the rhetorical question, how should pregnancies be screened for fetal growth restriction, and how is screening accomplished? Their answer is, all pregnant patients should be screened for risk factors for fetal growth restriction through a review of medical and obstetric history. Fundal height measurements should be performed at each prenatal visit after 24 weeks of gestation. A discrepancy between weeks of gestational age and fundal height measurement of greater than 3 centimeters has been proposed for identifying a fetus that may be growth restricted.
And then the next highlighted portion, you read that.
Although other approaches to fetal growth restriction screening have been studied, including universal third trimester ultrasonographer, uterine artery Doppler velocimetry, which is very complicated, but it's measuring flow of the blood by Doppler ultrasound through the umbilical cord to make sure that that flow is wide open. Doppler velocimetry and measurement of analytes, which just means blood tests, such as pregnancy-associated plasma protein A, which nobody does. There is evidence that these growth restriction screening methods...
There is no evidence.
There is no evidence that these fetal growth restriction screening methods improve outcome.
So the two paragraphs are saying you should use the fetal or the fundal height measurement.
Yeah, that all obstetricians should be using fundal height measurement to screen for IUGR.
And that's just as good a screening tool as all the other things that you had just mentioned.
Yeah, they have not been proven to be superior.
Doctor, looking at your screen, this is from the same article. This is before, actually comes before the other stuff that you had just explained to us. That box there, the boxed in portion. Explain to the jury what the box 1 says there at the top. What's the headline there?
Etiology, which is just a fancy word to say causes of fetal growth restriction, and it lists a bunch of things. None of them apply to Skylar until you get down to placental disorders and umbilical cord abnormalities, which is what happens when you have IUGR. You have a small fetus, a small placenta, a small umbilical cord, decreased amniotic fluid.
Then the next paragraph, so to speak, where it starts off at placental disorders and umbilical cord abnormalities. Could you read that?
Abnormal placentation, which just means the placenta is abnormal, that results in poor placental perfusion, i.e. placental insufficiency. So placental perfusion is the ability for oxygen to diffuse to the mother, carbon dioxide to go back to the mother, and nutrients to go to the baby, and waste products to leave. And if it doesn't work efficiently, that's called placental insufficiency, is the most common pathway associated with fetal growth restriction. So placental problems, often due to nutritional factors, is the most common antecedent to IUGR.
And you already discussed with the jury your opinion regarding the nutritional inefficiencies of Skylar Richardson, correct? Based on that blood.
And we know her weight on July 13th, 2016 of 134 pounds, and her weight 11 days before delivery at the doctor's visit of 149 pounds. So she only gained, in the face of probably caloric restriction, 15 pounds. For someone her size, the recommended weight gain is 25 to 35 pounds. And then when she went back to see Dr. Boyce on July 12th, she was already under her pre-pregnancy weight. She weighed 130, so she was already underweight, which means that usually takes a mother typically 6 months to get off those healthy baby fat pounds. And it was gone, and she was less than her pre-pregnancy weight 10 weeks after delivery, which is abnormal.
Could you read this right in here for the jury, please?
I apologize for interrupting. Dr. Counsel, approach, please. You may continue.
Thank you.
Wow. That's all I can say at this point. Wow. This doctor has shown up so far. Every medical expert that has been on this witness stand since the start of this trial. And so far, up to this point, all the medical experts has been coming from the prosecution. That should tell you that should say a little something then. But we still have a great deal more testimony to go. And Baby Kisses, as always, is in the house. How you doing? She says that Brooke Skylar Richardson looks like she's aged. Well, I'll say this much. If you seen her face at the start of the trial, and you have seen what her reactions throughout, That young lady, I'm about to sound like a broken record here, but it bears repeating. That young woman is literally scared to death. As I look like, no, I mean, it may seem on the surface she's paying attention to testimony, but deep down inside, if you look in her eyes, she's still wondering, how in the world did I get here? What did I do to get here? Now the question becomes once the testimony is done, will the jury label her a baby killer? That's why we're covering this case. This is why we're covering this case, and this is why I show the testimony in its entirety. Alrighty, I just don't give you bits and pieces. This is the entire testimony as it comes. So we're gonna go right back into the courtroom where testimony with Dr. John White continue.
Your Honor, could you read this perinatal morbidity and mortality? Could you read that sentence under that, please?
Fetal growth restriction increases the risks of intrauterine demise or stillbirth, neonatal morbidity or a seriously ill baby, and neonatal death.
And that is true, isn't it?
Yes.
Yeah. And Dr. White, in your review of everything, what findings led you to conclude that Skylar's pregnancy was complicated by IUGR?
Well, I think I've answered a lot of that. Let me make sure. Her low fundal height, her poor maternal weight gain, her history of eating disorder.
What about the unknown gestation period? Or unknown conception period?
Well, certainly the no prenatal care, taking no vitamins, iron during her pregnancy. Yeah, unplanned pregnancy, no prenatal care. It all made her high risk for that.
Doctor, I think you've already indicated that you reviewed Dr. Murray, who is the forensic pathologist, whose report is attached to the forensic pathologist called by the state. It was attached to her report. You reviewed that.
Yes.
And you gleaned from that Skylar's baby was what?
39 to 40 weeks, consistent with what we knew.
You're not, I mean, that's not a dispute.
No.
I know it's an obvious question, but I want the jury to understand this. Does IUGR that we've been talking about, does that increase the risks of stillborn?
Yes, substantially. If you're getting care at the doctor's office and you're going in for your twice weekly visits and delivered, we can minimize that, but even that, it's still probably 2 times. But if you're not going in for prenatal care, it may increase it 5, 8, 10, 30 times more likely to have a unexplained or a stillbirth.
I had to stop right here with that answer because I want to bring up a comment that Baby Kisses brought in, and I thought it was a very interesting. she was referring to the second interrogation video, the second interview, and she said, "Thank you. I'm about done with her and the interview." It was like they tricked her. I think anything they wanted her to say, she would have. Well, I hate to admit this, but this is a known police tactic. They want to get they want to get the answers by pretty much by any means necessary. So, knowing this, they will use just about any tactic, including being deceptive themselves, in order to get the answers they're looking for. And if and sometimes they're not ashamed to admit that they've done it like that. Yeah, but this is also why I love in a case like this having medical opinions one way or the other. And you're right, baby kisses. It is sad. They but they'll do what they have to in order to get the in order to get the information they're looking for. That's what they'll do to get the suspects they're looking for too. So we're going back to the courtroom. We're gonna hear more from Dr. John.
Dr. White does a fetal heartbeat of 140 beats per minute that Dr. Andrew heard when Skylar went to Dr. Andrew's office on April 26. Does that mean anything to you or your fellow obstetricians?
It simply means that at that moment, the baby is not dead. It means the baby's alive at that point.
Does it say anything about the health of the baby?
No, you would need to do much more, not invasive, that's not the word I'm looking for, but you need a much more thorough exam of the fetal heart rate. There's testing that we do in the office called non-stress testing, where we put the baby on a monitor with a graph for 20 minutes and we watch the heart rate, watch the baby move, and the heart rate go up when the babies move to reassure us the baby is in a healthy state. Make sure that you don't see a drop of the heartbeat when the baby moves, because that can be the cord being compressed. So we do those types of testing of the heart rate to assure fetal well-being.
Doctor, when a woman is complaining about cramps, does that mean labor?
It may or may not be. They all can cramp.
So, what about someone who's never been pregnant and they're naive? Would they know that when they have stomach cramps that they're in labor?
They may or may not. Sometimes they don't.
In your practice, do women that are your patients that come in and see you, do they often complain about pain?
I would say in pregnancy, probably at one time or another, it's pretty universal. They'll all have certain pains as they get further along in their pregnancy.
Doctor, does birth control, taking birth control pills while you're pregnant, does that in any way harm the fetus?
No. The only theoretical issue with birth control with one hormone in it is if you take it early on and you don't know you're pregnant in the first trimester, it could maybe masculinize a female fetus, or with the estrogen in the pill, since pregnant mothers have a lot of estrogen, it could potentially increase their risk of a deep vein clot and a blood clot to the lungs called pulmonary embolus. But taking a birth control pill in a term mother will cause no harm to the fetus.
Doctor, does IUGR affect the femur length of a baby?
It can. There are two main types of IUGR where the IUGR, the intrauterine growth restriction, affects everything in the fetus. We call that symmetric IUGR. Symmetric IUGR is usually more due to genetic abnormalities like Down syndrome or other trisomies, different infections like toxoplasmosis, things that affect the growth of the fetus from the time of conception. Asymmetric IUGR, where not all the parameters of growth are disturbed, is more, and it is called asymmetric IUGR, and is the most common type of IUGR. And that is when you have some type of placental dysfunction or placental insufficiency. And what happens in the third trimester, when the baby starts to really put on the weight, the femur is gotten long enough and will be relatively normal. The head circumference could also be relatively normal, but the abdominal circumference, the baby is like starving. There is no energy source in the liver, which is called glycogen, and the babies start to have very low abdomens. So that when you use the parameters for fetal growth to measure the growth on ultrasound, you will have a relatively normal femur length and abdominal circumference, but your abdominal circumference, excuse me, let me make sure I said that correct. You'll have a relatively normal head circumference and femur length, but the abdominal circumference will be very, very small. Essentially, just visualize a very skinny baby that's not being fed. And the calculation of the estimated fetal weight will give you beneath the 10th percentile. And these babies with asymmetric IUGR are the ones you must manage to prevent cord accidents and stillbirths from placental insufficiency.
And it's your belief, as I understand your testimony here
That
today.
Skylar had Skylar's fetus, Annabelle, had asymmetric IUGR.
Does full term mean that the baby is of normal weight or is a large baby?
Full term is 39 to 41 weeks and speaks to the weeks of gestation. Full term, saying a baby is full term does not tell you anything about whether or not it's appropriately grown or small for gestational age or intrauterine growth restricted.
One more question. Yesterday, it was Mr. Knippen for the prosecution here, had identified as Exhibit 134H as one of the pictures that Skylar was taking of herself. And this picture, move it down, this way. Is that pretty clear on your monitor?
Yes.
Is that clear to the jury? That's a foot, that's her foot on the scale. What does that tell us?
Well, if she,
Well, I'm sorry, what does it tell you?
if she weighed herself,
Wait, I apologize. Let me interrupt. There's one little part of the question I wanted to ask you that's missing. We know that that photo was taken May 11th. 5 days after she gave birth to Annabelle. Now, what does that tell you?
Well, what it tells me is that on May 11th, so 4 days, 8, 9, 10, 11, 4 days.
I'm bad at math.
This is actually, today's the first time I've ever seen this, so this is new to me. So 4 days after she delivered, that means that her weight was already 8 pounds less than her pre-pregnancy weight, which actually corroborates my conclusion that she was nutritionally deficient during her pregnancy because of her eating disorder, and she had no fat storage, because normally it takes 6 months to get that healthy fat off. And it gives me additional evidence to say that she had growth restriction from a caloric deficiency problem.
Thank you, Doctor. Just for the record, Your Honor, I would like to identify that portion of the police report that has been discussed 2 or 3 times in this case as Defendant's Exhibit MMMM. Thank you, Doctor.
Ladies and gentlemen, I think it makes sense for us to go ahead and break for lunch at this point. Remember what I have previously told you about the case. Do not begin discussing the case amongst yourselves, nor to begin to form opinions about how the case should be resolved. Do not do any research or read any of the media accounts during the lunch break. Let's plan on being back here at 1:15 with the idea that we are going to get back going at 1:30.
And they are good, and they're taking a break for lunch. And it seems to me that that this doctor's testimony is weighing heavily on the length. It's relying heavily on how long it took for Brooke, Skylar, Richardson to have this baby. And yeah, the baby kiss is saying exactly what I'm thinking right now. A lot is in this trial, a lot. And again, this is one reason why I show testimony in its entirety instead of just its and bits and pieces. Just not just what you think what I think is important, but I want to make sure everything you see and hear is of importance. So you can play the 13th juror. You get to decide by the end of this, after you've seen and heard everything, you can decide, is she guilty or not guilty of aggravated murder, guilty or not guilty of child endangerment, guilty or not guilty of involuntary manslaughter, guilty or not guilty of abuse of a corpse. You're hearing everything. You're hearing everything. You're seeing all the evidence from the interrogation footage to documents that the medical experts have. All of it. I'm not gonna leave you hanging in the air just to figure the whole thing out before you even get to the verdict. That's not what I do on a normal BETHEA'S BYTE, nor will I do it here in a BETHEA'S BYTE Reloaded Throwback. Now, we're going to take it at the point that the break is over. We are going to go back into the courtroom, and as they used to say on the People's Court, the testimony continues.
Ladies and gentlemen, welcome back. Was everybody able to follow my instructions and admonitions over our lunch break?
Yes, sir.
All right, Mr. Rickers, you may resume. All right, so you're done?
I'm done. Yes.
Ms. Kraft, you may proceed.
Thank you, Your Honor.
Good afternoon, Doctor.
Good afternoon.
I want to start out by just going through, you had given a list on direct examination of the materials you reviewed in reaching your conclusions on this case.
Yes.
Can you please list those again?
Okay. I reviewed the Hilltop OBGYN records. I reviewed the Children's Hospital medical records, the Carlisle High School records. I reviewed the DNA report that confirmed parentage. I reviewed the sheriff or the police report that included the Trey Johnson interview. I reviewed the forensic anthropologist Elizabeth Murray's report dated September 6th, I believe. I reviewed the assistant coroner's report, Allen, dated September 19th. I reviewed the Dr. Latham, the Indianapolis forensic pathologist report that I believe was dated January 28th. I reviewed probably 5 or 6 times the transcript, which I had on a flash drive, of the July 14th and July 20th interviews of Detective Fain and Officer G the first time, and then Detective Fain and Detective Carter on the 20th, I believe. I'm correct on that. I reviewed a email chain from September 27th, 2017 to September 28th between Prosecutor Knippen and Murray and Latham discussing the forensic anthropology report and the decision to consult Latham. I reviewed Mr. Levon's opinion. I feel like I'm leaving something out. That's all I can think of right now, but there may be something else.
You would agree you didn't include all of that in your reports, correct?
The Latham report, I can't remember. Oh, I also reviewed at some point Dr. Baker's, or Dr. Brady, excuse me, his report. I included what I thought was pertinent for the time that I wrote the reports. I wrote one report, and then I followed that up with another report.
Okay, you wrote a report on February 7th of 2018 and March 28th of 2018, correct?
That sounds right, yes.
And you would agree that all of the materials that you just listed are not included in both of these reports?
Certainly not all of the material is included. It was what I had at the time to review.
So this is what you had to review at the time when you wrote your reports?
That is what I had to review at the time of the reports.
So anything that you just listed that's not included in these reports, you looked at after you reached your conclusions that you put in these reports?
Or I felt like they weren't pertinent to my opinion of the stillbirth delivery and didn't include it, or I reviewed it afterwards.
Okay, so the only thing, I want to be clear then, the only thing that was pertinent to your diagnosis of intrauterine growth restriction and stillbirth are the things that you've listed in these two reports.
When I wrote each report, those were my opinions of the information I used at that time. Subsequent to those, and I can't really remember the time that I reviewed things, but other things kind of came about that I reviewed, and there was no need for me to change my opinion because my opinion stayed the same.
Okay. And you keep telling the jury, I reviewed her statements 5 or 6 times, correct?
Overall, from the time I initially received them, the first thing I think I received was not the entirety of the reports and the audio on flash drive, but I reviewed those, I would say, 5 or 6 times, and I'm speaking from the time the case was first filed until this morning.
Okay, well, doctor, I want to talk to you about what you based your opinion on in these 2 reports, okay?
Sure.
And in the second report, because your first report you authored without reviewing anything from either interview, is that correct?
That's my recollection, but I wouldn't state that for certain.
Well, do you have your reports up there still?
No, I do not.
Your Honor, may I approach? You would agree that in your February 7th report, it does not indicate in the materials reviewed that you looked at either one of the interviews?
Yes, I agree that. It's not in there.
Okay. And now I'm going to hand you your report dated March 28th of 2018. Can I have that one down, please? And what does it say you reviewed that time?
I have reviewed the supplemental discovery items recently submitted to me, including Dr. Brady's report and excerpts of the July 14th and 20th interrogations of Skylar Richardson, and also the obstetrical literature to come with my conclusions.
Doctor, can you please tell the ladies and gentlemen of the jury, when you authored this opinion on March 28th of 2018, what were the excerpts from the July 14th and July 20th interview that you reviewed?
They were focused mainly on her answers in the the July 14th interview, where she discussed approximately 20 times and described the baby not breathing, not moving, not opening its eyes. And then in the July 20th, there were some excerpts that talked about the baby being pale, and then some issues with did the baby gurgle or not gurgle and that type of thing. But specifically, I don't remember every excerpt that was given to me, and that's why when I subsequently met with Mr. Ritkers, he said, you need to review the entirety of the transcripts.
Because that would have been the right thing to do, correct?
Correct, and that's why I felt it was my duty and responsibility to make sure that I reviewed all of the transcripts and much of the audio, not much of the video, so that I could base my final opinion on the entirety of both interviews.
Because that was your duty and responsibility.
Correct.
But when you authored this report, you didn't comply with that duty and responsibility, did you?
Well, I didn't know that at that point he was going to have me do that, and was asked to file the report, and I don't know why at that point he hadn't given me the entirety of the transcript. I think when we had a meeting, I may have said, you know, do you want me to see the entirety of it? Because there was a lot of it that involved things like whether or not Annabelle was burned or not burned, or that didn't really apply specifically to what I was looking at, but he thought at that point that I ought to go ahead and look at the whole thing.
In case you were asked a specific question on
Correct.
cross-examination?
Correct.
So despite your duty and responsibility, because we just kind of talked around that a little bit, I want to make sure. When you authored your February 7th report, you had not reviewed any transcripts, correct?
If
That's
that's
your
what my
recollection.
report says.
And on March 28th, despite your duty and responsibility, you looked at excerpts that were selected by the defense.
Right, at that point, I was basing my opinion on the medical data that I had reviewed.
And I think I just caught something that you said, but I want to make sure we're clear. To this date, you still have not reviewed the entire audio or video.
No, I reviewed the entire audio, but not the entire video. I kind of looked at the video and felt like, you know, the more important thing other than the video was what was being said, and just to make sure I could get through it so that I can understand it. For me to read a written transcript, I can go a lot faster than I can follow an audio or a video in real time.
Doctor, you have today definitively said that you are diagnosing baby Richardson with intrauterine growth restriction, correct?
To a reasonable degree of medical certainty.
In this courtroom, that's what you're saying.
Yes.
You would agree, February 7th report, it was a likelihood, likely complicated.
Likely being greater than 50-50, more likely than not. And then as I continued my review, I'm prepared today to say that I believe it to be true to a reasonable degree of medical certainty.
Doctor, do you stand by the reports that you wrote?
Yes.
Okay.
Other than the changes that I made from one to the next, or anything that I said earlier today based on my subsequent review of the entire transcript that could vary somewhat. I think that's the normal evolution of trying to give an honest opinion so that the court can decide how the case is decided. So anything that I've reviewed up till now, I feel compelled to say, even if, and I don't think there's been a huge change in my opinion from my original opinion that I gave to Mr. Richardson today, but it has evolved somewhat just based on the information I have available to review.
And the additional material would be what Ms. Richardson said during her interviews?
The entire transcripts of the July 14th, and I can't remember exactly when I got Latham's report and reviewed it. I don't know if that's in there. That her report was given to the prosecutor's office on I believe about January 26, 28. So at that point I hadn't received it, at least by the initial one, and I can't remember for sure if I got that before the March one. And I didn't receive like the email chain for a while, and I don't remember if I included that in my two opinions that I first wrote.
Okay. But now you've gone from likely complicated to it's definitive, right?
To a reasonable degree of medical certainty.
And I want to be very clear, you yourself never examined Brooke Richardson, correct?
That's correct.
You never did any measurements of that child?
That's
the
correct.
Fetus, baby Richardson?
That's correct.
You never reviewed any ultrasound
That's correct.
of baby Richardson?
That's correct.
You never talked to Dr. Andrew?
That is correct.
So the information you have is from a review of the records and what the defendant shared with you through her transcript.
And the other issue,
the
the other items
other
that we
documents.
discussed.
You have one measurement in this case, correct?
Excuse me?
One measurement in this entire case of baby Richardson.
One measurement of what?
You have one measurement in this entire case of baby Richardson.
One measurement of what?
Baby Richardson, the fetus, baby Richardson.
We have more than one measurement of.
You do.
We have the femur length, and we have the fundal height measurement of the mother that is reflective of the uterine size that baby Richardson was in.
Okay, well, let's talk about that. You are making this diagnosis of intrauterine growth restriction based on standards that are not accepted within your own industry. Isn't that correct, doctor?
I'm basing my opinions on my evaluation of the entirety of the history,
Doctor?
the physical exam of the fundal height, the findings of the fundal height, and the course of her labor and delivery and her interviews, what I'm basing it on.
You have nothing to corroborate Dr. Andrews' measurement of 32 centimeters, is that correct?
Correct. I needed to rely on the records and all the information that I reviewed to make my opinion. And I did. I tried to rely on all the information I had available, but I am limited
To that
on
one
what
measurement
on.
during-
Well, I'm limited to my ability to give you my opinion based on my evaluation of the entirety of the clinical situation.
But you just told these ladies and gentlemen you gave your opinion to a reasonable degree of medical certainty, correct?
That is correct. That's what I
But
was
it's a
able to.
limited opinion.
To a reasonable degree of medical certainty I'm comfortable with stating that based on the information that I had to review.
During the life of baby Richardson, you had one measurement, correct?
I think, I'm just asking you to clarify what measurement. Are you referring to the fundal height?
During the life of baby Richardson, you had one measurement of the fundal height, which was approximately 32 centimeters.
I'm sorry, I'm not trying to be evasive, but I was just trying to make sure that you were speaking of the fundal height and not other measurements that were taken, because there were a lot of measurements taken at different times. But if you're speaking we had the forensic anthropologist, we had all kind of measurements
Doctor,
taken of bones.
Your Honor,
No, I was just trying to get I was just trying
Hold
to.
on, not talking to you, talking to me.
I'm asking him about how many measurements he had to base his opinion on during the life of baby Richardson. And he wants to keep talking about these other measurements that were taken
I
post.
think he's doing his best to answer your questions, Ms. Kraft. But if you could maybe specify what kind of measurements you're talking about, that might make it more clear for all of us.
Dr. White, prior to baby Richardson's death, how many measurements do we have in this case?
If you're referring specifically to the fundal height measurement, we had one fundal height measurement at 32 weeks. If you also, as a definition of measurement, you could be talking about weights, blood work, those are all measurements. That's just my confusion is trying to answer this as a physician.
Okay, well, do you have the weight of baby Richardson prior to May 5th anywhere in your records?
There is no weight of baby
Do you have
Richardson.
blood work for baby Richardson prior to May 5th?
We have blood work from Skylar, but obviously no blood work from Annabelle.
So with regards to baby Richardson, prior to her death on May 7th, you would agree that we have one measurement that strictly relates to her?
Well, I disagree with that in the fact that we have a maternal weight measurement. We have other laboratory evidence that we can use to come up with a opinion. With it, I could come up with an opinion.
So you're telling me you have the ability from Brooke Richardson's weight to tell me how much baby Richardson weighed?
I am able to assess that there is, to a degree of medical certainty, the stillbirth was due to intrauterine growth restriction, due to a constellation of findings, one of them being the fundal height measurement at 39 weeks.
You have a fundal height measurement at 39 weeks now.
I believe I stated earlier that when I looked at the police report and we were able to date the conception date, with the latest being August 7th, that her gestational age at the obstetrical visit on April 26th was 39 weeks and 2 days.
I don't want to work backwards because I want to try to get through some of these questions I have for you, but you would agree in both reports you never listed the police report as something you reviewed?
If I didn't, I didn't even know that information existed if I didn't list it. I thought actually in the second report, I think I did change that
Oh, you did,
to 39 to 42 weeks.
and we'll get there. If Dr. Andrew came into this courtroom and said that you need more than one fundal height measurement to make a diagnosis of IUGR, would you disagree with him?
If you had a 32 centimeter fundal height measurement with a known gestation of 39 weeks, you would start following that patient for intrauterine growth restriction.
You would agree at the time that Dr. Andrew saw Ms. Richardson, nobody knew when her conception date was because that information had not been provided by her.
That is correct.
Okay. So when you have no baseline to measure anything off of, and Dr. Andrew says you need more than one fundal height,
Well, I'm not-
do you disagree with him?
I'm not critical of all that he did not make that diagnosis because, excuse me, that's all he had to go by. So his assumption that she was 32 weeks based on a measurement of 32 centimeters. So on April 26th, that was a very reasonable assumption that he made with his one fundal height measurement, that she was 32 weeks. And he stated that in his note that she was 32.
If Ms. Kraft asks you a yes or no question, she's
Okay,
entitled
sorry.
to a yes or no answer.
Thank you. I'm sorry.
If it was if you would disagree with Dr. Andrew, that Dr. Andrew said he would have needed more than one fundal height measurement to make a definitive diagnosis.
On April 26th, yes.
Okay.
I agree with it.
You agree with him?
On April 26th.
And when Dr. Brady says that he agrees with Dr. Andrew that you need more than one measurement to make a diagnosis, more than one fundal height measurement to make a diagnosis of intrauterine growth restriction, you then agree with him as well.
Unless you have a known gestational age at 39 weeks with a fundal height of 32 centimeters. With that information not being known on April 26th, I agree with that.
We've had a lot of testimony or questions asked in this courtroom about using a measuring tape for fundal height measurement. Why is that important to you?
Because that's how you need to measure the fundal height with the measuring tape.
And would you agree that using a measuring tape is more accurate than using your hands?
You cannot do a fundal height measurement without a measuring tape.
I'm not sure what you reviewed in this case because not everything is listed in here. When you were given additional materials to review, were you given the recorded interview between Dr. Andrew and law enforcement regarding the April 26th appointment?
I do not recall reviewing that.
You do not recall reviewing it. Would it have been helpful for you to hear that or would it have affected your opinion when you're relying upon this 32-week measure, this 32 centimeter measurement, if it was not done with a measuring tape?
I would rely on the medical note.
You would rely on the medical note. And you would agree in this case, the medical note does not indicate whether it was done with a measuring tape or hands.
It measured 32 centimeters, which cannot be done with your hands.
So you would have wanted to know then if in fact a measuring tape wasn't used, is that correct?
The assumption that all doctors would make if you
Dr. White?
no, I'm sorry.
Again, if Ms. Kraft asks you a yes or no question, she's entitled to a yes or no
Okay,
answer.
I'm sorry. Go ahead.
Would you have wanted to know if Dr. Andrew did not use a measuring tape before you based your opinion of intrauterine growth restriction on his measurement?
I can't answer that. It doesn't have a yes or no answer.
But you just said you can't do it with your hands, correct?
That, yes.
And so if somebody does it with hands, you would not want to rely on that, is that correct?
Object, Your Honor. There's no
Overruled.
testimony.
The objection is overruled.
It needs to be done with a tape measure.
And you were not given his recorded interview with the police officer to review when you were making a determination?
I was given his medical note, so no.
Your Honor, at this time, I would like permission to play the recorded interview, that excerpt, so that he can hear
Approach,
it.
please. All right, Ms. Kraft, you may resume your examination.
Thank you, Your Honor. Doctor, if I represent to you that Dr. Andrew, who is the one that did the fundal height measurement of baby Richardson, represented to the investigators that he obtained that measurement by feeling her abdomen with his hand, no measuring tape, how does that impact your opinion?
It's just taken me a few seconds because I haven't thought of it if we did not have a fundal height at 32 weeks.
Let me ask you this, doctor, is that something that you would have wanted to know?
Well, I'm still working. I'm going to give you an answer in just a second.
Okay.
It certainly would have made me less certain of the diagnosis of IUGR. I still would have had suspicions based on the poor maternal weight gain, the lack of prenatal care, the weight that she was underweight when she came back to the doctor, and then I found out today, 5 days later. So I would have had less confidence in my medical degree of certainty, but it would have not changed my overall opinion that she delivered a approximately 40-week stillbirth at home that early morning.
So you still would have been confident making an opinion of IUGR on a technique that you just said a few minutes ago could not be done?
I'm unable to say with certainty my level of confidence, but I still would have been able to state with confidence that all the other findings were consistent with a stillbirth. IUGR would have been in my, what we call in medicine, my differential diagnosis.
But it might not have been the diagnosis
Might not
anymore.
have been the number one.
Okay. And fundal height, no matter how it's done, is just a screen, correct?
Correct.
It's not diagnostic, it's a screen.
It certainly helps key you into the diagnosis so you can follow with ultrasound.
So you can follow it, because you said on direct, after 24 weeks, you want to measure the fundal height at every single solitary appointment with a tape measure, correct?
That is correct.
And that's because you're going to start getting benchmarks. So you have something to measure against to see if this baby's growing, correct?
Well, you want to be, I wouldn't necessarily say benchmarks, because the benchmark is really the gestational age. You want to be sure that the growth curve is still continuing
to go
and
up.
it hasn't stopped growing.
You're aware in this case that nothing was done to corroborate that estimated fundal height?
Yes, I am.
There were no additional measurements.
Yes, I am aware of that.
There was no femur length taken.
Yes.
And you even
Correct.
said you need femur length in your first report, correct?
Yes.
Okay. So the reality is on April 26th, we have no idea how many weeks the baby Richardson was.
Exactly.
None.
Exactly. He had 32 centimeter fundal height, and he estimated 32 weeks, but he didn't know with any certainty.
Because it's just a screen.
Well, in the absence of knowing the gestational age, it's not even a screen.
And at that time, nobody even knew the gestational age, correct?
That is correct.
So we have no idea what the gestational age is, you would agree, on April 26th?
On April 26th.
We have no accurate fundal height measurement if it's being done with his hand.
Correct.
And even if it's done with the hand or the measuring tape, you're aware that baby Richardson was already in the cephalic position on that date?
Yes.
And cephalic position means the head has now engaged, correct?
No.
You disagree with that as well?
Yes. The cephalic position has, am I allowed to clarify my answer?
If she asks you another question.
Are you aware that both Dr. Andrew and Dr. Brady said cephalic presentation would affect the measurement?
No.
You disagree with both of them on that?
Yes.
In your report, you indicated you looked at some relevant, pertinent literature was reviewed in order to reach your opinions, correct?
Correct.
And one of them was the Williams Obstetrics Textbook, Volume 17.
If I stated that, I did. That's been a while ago, and I haven't looked at it since.
Your Honor, may I approach?
You may.
I'm handing you your March 28th report again. Can you look at your pertinent literature that you reviewed, please?
Okay, yes.
And that was one of the books that you looked at, correct?
Yes.
Mr. Ritkers asked you if you agreed with Dr. Brady when he said that the error rate after 30 weeks by relying on just a fundal height measurement is greater than 60%.
Correct.
You said you disagreed with that, correct?
Yes.
Doctor, do you see where it says uterine fundal height?
Yes.
Carefully performed serial, so that means more than one, correct?
Correct.
Uterine fundal height measurements throughout gestation are a simple, safe, inexpensive, and reasonably accurate screening, and they even have screening in italics, correct?
Yes.
Because it's not a diagnosis, it's not a diagnostic tool, it's a screening tool, correct?
Yes.
And that's when there's serial, more than one, correct?
That's what they state.
May be used to detect many small for gestational age fetuses. You would agree that's what the first sentence says, correct?
Yes.
The principal problem is the imprecision of such fundal height measurements. You agree that's what the next sentence says?
Yes.
And this is a book that you rely upon, correct?
Yes.
And then they cite a study, Jensen and Larson, correct?
Yes.
Synthesis to fundus measurements help to correctly identify only 40% of such infants. Thus, small for age infants were both overlooked and overdiagnosed. Would you agree with that?
I agree with that's what it says.
Well, this is a book that you rely upon, correct?
I do rely on the Williams Obstetrics book.
You listed it in your report, correct?
I do rely on this book, yes.
So you're not disagreeing with the book that you rely on, correct?
And you stop reading of that paragraph.
Well, we can finish.
Would you like me to read it out loud, or would you?
Thus, small for age infants were both overlooked and overdiagnosed. However, these results do not contravene carefully performed fundal height measurements as a simple screening method that is used for supporting many but not all, suspecting many but not all instances of fetal growth retardation. 60% error rate, correct?
That's what the Jensen and Larson study said in 1991.
Is this the book that you rely upon or not, doctor?
Along with everything else.
Along with everything else. You would agree, doctor, we have an unreliable measurement in this case. A
No.
hand measurement. We have a hand measurement, doctor.
I don't know that.
Well, if I represent to you that in his interview, he said that he used his hand, not a measuring tape, you would agree that we have a hand measurement.
No.
So now Dr. Andrews lying to the investigators?
I don't know. Dr. Andrews recorded 32 centimeters in his medical note.
You don't know how it was obtained. As you sit there today, you do not know how it was obtained, correct?
Correct.
And I'm asking you, if I represent to you, because you said you can't do fundal height measurement with a hand, if I represent to you that that is what Dr. Andrew told the investigators, that is how he came to that measurement, then according to you, that's not a reliable measurement, correct?
It's not a measurement at all.
We don't have any serial measurements in this case, correct?
Correct.
We don't have any serial ultrasounds.
Correct.
We don't have any femur length measurements at the time that baby Richardson was alive, correct?
Correct.
So your assumption that we have any leg, whether it's 3 centimeters, 5 centimeters, 7 centimeters, is based on nothing. There's no reliable measurement that you have in this case to base your opinion on that there is a leg in this baby's growth.
Can you, well, I didn't quite get your question.
You don't have a measurement if it was done by Dr. Brady's hand, correct? Or Dr. Andrews' hand, correct?
Correct.
You don't have any other fundal height measurements in this case, correct?
Just what's documented in the medical record.
Which you said if it's done by his hand, it doesn't count, correct?
Yes, that's correct.
You don't have any serial ultrasounds.
That is correct.
You don't have any femur lengths
Other than the forensic anthropologist.
during the life of baby Richardson. I'm not talking about after baby Richardson died. I'm talking about when she was still alive and healthy in her mother's belly.
So the question is,
You
What
don't
was
have
the
a femur
femur
length measurement while baby Richardson was alive and healthy.
the femur length at the anthropologist report would be the same at the time of death.
You have no data from this case to make your diagnosis of intrauterine growth restriction, do you, doctor?
If your assumptions are correct.
And if you have no measurement of this baby because it was done with Dr. Andrews' hand, you have no idea if there's any leg in this baby's growth, do you?
Other than the other risk factors, but it's less I would be less sure of it.
Okay. You talked about other things on direct. One of the things that you tried or said that you took into consideration was the defendant's weights.
Yes.
Correct? I want to talk about that. You said that you reviewed a sports physical, and I wrote this down because I don't know if you got the date wrong or if you were referring to something other than what was listed in your report, that you looked at a sports physical from September 13th.
I misspoke. It was July 16th, 2016. I think I said September and corrected it, but the sports physical was done July 13th, 2016.
And that was a weight of 134 pounds, correct?
Yes.
You're aware, you've testified, you know that Ms. Richardson has an eating disorder, correct?
Yes.
You have nothing in any of the records that you reviewed to tell you what her weight was in August of 2016, is that correct?
Correct.
September of 2016,
Correct.
October of 2016,
Correct.
November of 2016,
Correct.
December of 2016.
Correct.
You don't have another weight until we get to April 26th, correct?
Correct.
The defense has shown a lot of pictures in this courtroom of her weight going up and down. During the 9-month period that that baby was inside of her, you have no information as to what her weight was, correct?
When we calculate maternal weight gain, we use the pre-pregnancy weight and the weight at delivery, or in this case, the closest to delivery 11 days prior. But no, we don't know what she did during.
No idea. You don't know if her weight was up, you don't know if it was down, correct?
Correct.
You don't know how much it fluctuated?
Correct.
I mean, we've seen pictures where in 6 months she managed to take off 30 or 40 pounds.
Correct.
You have none of that for this 9-month period.
Correct.
You have a weight in July of 2016, mid-July of 2016, and you have a weight in April of 2017.
Correct.
You don't know what, if anything, she was doing to her body as far as taking laxatives to hide her pregnancy weight, correct?
Correct.
You don't know how much she was or wasn't exercising.
Correct.
You don't know how much she was or wasn't eating.
Correct.
So you don't know what her weight gain was. Is that correct?
I know what her maternal weight gain was.
And that's assuming that she did nothing during that 9 months to alter her weight. You don't know if it went up and then she went down, if it was getting to be too much, so she quit eating. You don't know any of that, do you?
No.
So we really don't know how much weight she put on throughout the course of the pregnancy,
We know a maternal weight gain of 15 pounds.
based on a July 13th date and an April 26th date.
Correct.
But you don't know what happened in that intervening 9 months.
I do not know how the spikes went.
Now, in your first report, February 7th, your first report. Your Honor, may I approach?
You may.
Actually, I'll just put it up here for you. Can you read your second statement that you put in your report?
Therefore, based on the above, Ms. Richardson's due date would have been on or about May 14th, 2017. This would place her likely conception date around August 21st, 2016.
That's not what you testified to today, is it?
Correct.
And the only thing that you had after this report were her excerpts from the interview before you wrote the second report.
I'm not sure, based on that, when I got the interview with the police and the father of the baby, where he said when they had sex.
Doctor, in your first report, you reviewed the Hilltop OBGYN records, correct?
Correct.
The Children's Hospital medical records, correct?
Correct.
The medical records from Miss Lori Dunham, correct?
Correct.
Carlisle High School records, including health physical records.
Correct.
That's the sports physical you're referring to,
Correct.
correct? Medical records from Cincinnati Center for Wellbeing, correct?
Correct.
Report of Kent Hirschberger and autopsy report of Dr. Allen, correct?
Correct.
Report of Elizabeth Murray.
Correct.
And you came up with August 21st,
Correct.
which is almost a month later than what you're saying today, correct? At least 3 weeks off.
It's, well, no, I believe it's 2 weeks difference. I believe that report says I estimated her due date at May 14th. And I believe my earlier testimony said the window was that her latest date of conception would have been August 7th, which places her due date at May 1st. So there'd be 14 days difference.
But you initially said August 21st, correct?
As a conception date.
As a conception date. And today, on the witness stand, you said late July or early August.
With the latest date being August 7th, which again is 14 days difference.
Okay. So were you 2 weeks off then or 2 weeks off now?
Well, in my opinion, I was 2 weeks off then.
Okay. And this is based on a statement that was contained in the police report?
That opinion of mine was based on Elizabeth Murray's forensic anthropology result, that where she measured all the bones, she measured a lot of bones, and got a lot of different measurements, and they were all consistent, 38 to 40 weeks. But the one that I utilized is because the one its obstetricians utilized the most, and we deem as the most accurate, was a femur length. And the femur length was 38 to 40 weeks, so average 39 weeks. That's how I came up with that date.
That's how you came up with the August 21st.
As the conception date for a due date of May 14th.
And you're not aware of what other witnesses have testified to in this case, correct?
No.
Okay. So if the forensic anthropologist said that based on all of the bone measurements, baby Richardson was 38 to 40 weeks, you agree with that based on the information that's been provided to you?
That's the size of the fetus at death, yes.
And based on that information, you came up with the August 21st conception date?
Correct.
People don't always give you accurate information, correct?
Correct.
You would rely on this though, wouldn't you?
And that's why I did,
And that's how you came up with the August 21st date?
originally.
Okay. Are you aware that in this case, the father of the child testified and said that they did not have sexual relationships until well into August?
No.
Are you aware that Miss Richardson sent her boyfriend a text and said their relationship wasn't until August?
No, I don't have that information.
You weren't given that to review either?
No.
So this conception period that starts into July, you're now aware they weren't even together at that time?
I guess if that's the truth, it wasn't in July, it wasn't in July.
Well, doctor, again, when you testified on direct, the conception date was one of the things you used to reach your opinion to a reasonable degree of scientific certainty.
Correct.
So now you know that you don't have an accurate conception date, correct?
If I don't have a possible conception date of August 7th, based on the police interview with Mr. Johnson, I believe I have his name, if that police report is not accurate, then my most accurate data point will go back to the femur length, which would place Annabelle at time of her death at 39 weeks and not 41.
And that conception date in your original report, before you changed it, of August 21st, is consistent with what Trey Johnson testified to and consistent with what she texted to Brandon.
I accept your word for that.
Thank you. Now, you said, and the defense used a side-by-side photo, that one of the things you also took into consideration were photographs. You even talked about that in your March 28th report, correct?
Correct.
That you were presented with photographs, and we've seen it a couple times now, when she bought the dress and when she went to prom, those side-by-sides.
Correct.
And based on those side-by-sides, you again think that there wasn't sufficient weight gain.
It was concerning to me when I saw those photos.
What do you see depicted in that photograph, Doctor?
Skylar in her red prom dress next to a gentleman whose face is cut off in a suit in front of their mantle. And this appearance looks like it's on her prom night and looks very similar to the photo I looked at before.
Okay. Do you know what a corseted dress is?
No.
Do you know what a corset is?
I think I have an idea. Yeah.
What do you think it is, Doctor?
A corset?
Mhm.
It's like a girdle.
You can tighten it up, or you can loosen it up, correct?
Correct.
Are you aware that the back of that is a corset?
No.
That is a corseted dress? And so you can tighten it up to make
Okay.
sure it fits nice and snug,
Okay.
and you can loosen it up to accommodate weight gain. Are you aware of that?
I probably should be, having 2 daughters and a wife, but no.
Okay. So you don't know how much she loosened up the back of that dress from February to May, do you?
No, I just see the
Just the front of the
straight-on
dress.
appearance of what it looks like to me.
Again, you said on direct you took into consideration her blood work. And you disagreed with Dr. Brady that there were no nutritional concerns indicated on her blood work because of an RDW level.
Correct.
And that now, today, you find that interesting, correct?
Yes, I find it interesting.
Okay. If we go all the way back to February 7th, you had the Hilltop records, correct?
Correct.
And you had them when you did the March 28th report as well then, correct?
Correct.
Never mentioned that number in either one of these reports that caused you any concern, did you?
Correct. I admit I didn't even notice it till the last week myself.
When you reviewed Dr. Andrews' records and even Dr. Boyce's in July of 2017, are you aware that both of them indicated that she appeared well-nourished?
I'm aware of that said that, yes.
Okay. And you have no reason to discount their assessment of her
No.
nourishment at that time?
No.
And Dr. Andrew had the blood work. Didn't
Correct.
cause any red flags for him, correct? And you've indicated that you never talked to Dr. Andrew when you looked at this case, correct?
Correct.
He's the only person in this case that treated her while she was pregnant?
Correct.
that performed an ultrasound,
Correct.
felt her abdomen.
Correct.
Did you see anywhere in the record that he had any concerns about intrauterine growth restriction 2 weeks prior to that baby's birth?
No.
Did you see any indication that that baby had any dysmorphic features on ultrasound?
No.
Did you see any indication that there was a concern about a decrease in amniotic fluids on the ultrasound?
No.
Baby had a strong heartbeat, and even you indicated at 140 beats per minute that baby's alive, correct?
Correct.
And that's 11 days prior to her birth.
Correct.
Are you aware that Dr. Andrews said he had no reason to believe that she wasn't delivering a healthy, viable baby?
I'm sorry, that question again.
He had no reason to
Was the
believe
question, was I aware of that he said that?
that based on his one assessment, because that's all she went in for, he had no concerns.
I just misunderstood. I didn't hear your question. Did you say, did I?
Are you aware that he had no concerns about the viability of that baby?
No, I'm not. I wasn't aware of what his concerns or no concerns were.
Are you aware that his only concern was her presentation and insistence that she couldn't have a baby and no one could know?
No, I don't know what his concerns were. I know they were trying to reach her to come back for a prenatal appointment.
Would you have wanted to know that?
No, I understand his reasoning for wanting to get her back for a prenatal visit, and I understand his concern about the unplanned pregnancy. I have total empathy for where he found himself to be on April 26th.
I mean, let's talk about that, doctor. If a girl came into your office and you believe her to be in her third trimester, and she's telling you, I cannot have this baby, I'm going to college in the fall, I cannot have her, would that start to cause you a little bit of concern?
Well, yes, it does, and I've counseled women, and I've served on as board chairman on organizations, and I've had to make referrals to abortion centers. I've seen all of that in my career, and yes, it's concerning.
And saying you can't tell anybody, nobody can know about this baby. Is that concerning?
That, in my experience, is a very common interaction in what we term crisis pregnancies, unplanned pregnancies.
Doctor, have you ever been so concerned that you felt it necessary to give suicide warnings?
In medicine overall, in my 30 years?
Yeah.
Absolutely.
And when you give
Absolutely.
suicide warnings, what's your concern?
If we try to ask the question, are you thinking about harming yourself or harming others? And that would be a situation where HIPAA no longer applies.
Because at that point, you want to make sure that that healthy, viable fetus is not going to be harmed, correct?
Or the mother's not going to kill herself, which
The
happens.
mother's not going to kill herself.
Correct.
So for you to give suicide warnings, there's got to be a pretty significant concern.
So if you mean alerting the authorities or alerting someone to potential
One
suicide?
question at a time. If you give your patient suicide warnings, you're pretty concerned at that point, aren't you?
I'm missing what you mean by suicide warning.
Well, have you ever given a patient suicide warnings, caution them about hurting themselves and or the baby?
Yes.
And were your concerns pretty heightened at that point?
If my assessment was that they were a suicide risk, I would not stop with telling the patient, don't go out and kill yourself. I would either alert the authorities or alert the family member that this was an acute emergency and that person need to be admitted to the hospital, and I have done that.
Because you felt there was a risk to the mother or to the baby?
Correct.
Because you don't give everybody that walks into your office suicide warnings, correct?
Well, if we have someone who comes in with postpartum depression or any situation like this, or a crisis pregnancy, we try to ferret out what the suicide risk is and act accordingly.
Doctor, you keep using this term crisis pregnancy. What do you mean when you say a crisis pregnancy?
A crisis pregnancy is a pregnancy that is unplanned, unwanted, and they don't know what to do about it. And they don't know, they often, in a crisis, they will often say, I can't have this baby. Sometimes it's her parents, sometimes it's her husband, sometimes it's her boyfriend. Somebody's going to harm me. I can't be pregnant. And then it's up to the obstetrician and our social network to decide what to do about that. That's a crisis pregnancy.
And you would agree that based on her presentation, she fit that criteria, correct?
If that was Dr. Andrews' assessment, I accept his assessment. I didn't see where they did those steps I mentioned.
You're aware in this case, because this is how we got here, that her reaction on April 26th, coupled with the fact that we no longer have a baby after him believing there were no health concerns with that baby, he made the decision to notify the police?
My understanding is by Ohio law, it wouldn't have mattered what she would have said. If someone comes in and they're pregnant and then they don't have a baby, you notify someone that there's a baby somewhere.
That's not normal for babies to just disappear, correct?
That is not normal.
Now, doctor, from this intrauterine growth restriction diagnosis that you previously said was definitive, from there you then made the leap to say that we now have a stillborn child, correct?
Correct.
You were not there the evening of May 7th, were you?
Correct.
You are dependent now, because that's where what's changed in your report from February 7th, it was likely, and then in March 28th, after you reviewed certain excerpts from her interviews, now we definitively have a stillborn child, correct?
To a reasonable degree of medical certainty.
In your report, one of the things that you talked about in trying to come up with this diagnosis of stillbirth was there was no apparent gush of fluid. And so from that, because she didn't say there was an apparent gush or leakage of fluid, you determined that there was no breaking of the water, or there wasn't significant amniotic fluid. Is that correct?
That's the crux of it, that there wasn't much amniotic fluid when she delivered.
Which transcript did that come from?
I believe I remembered in the Carter, the 20th, that there wasn't a gush.
There wasn't a gush. Do you know where that was in the second transcript?
My notes would have it, I can't remember.
Okay. This is the first transcript where she was questioned about her water breaking. or any amniotic fluid. And this is on page 16. Lieutenant Payne says, have you ever heard the term when people say their water broke? And Skylar says, yeah, I don't know if that, you didn't feel that? I don't know.
Are you able to scroll down?
Sure. Well,
So it's not on this page, but I remember reading, and I can't remember the page number, like I said, it'd probably be in my notes, that there wasn't a gush.
There wasn't a gush? But you don't know where that was in the interview where she said no gush?
Long interview, even with reading it a lot, I can't remember.
But you specifically recall seeing or reading her saying there was no gush?
To the best of my recollection.
Because you would agree, when she's asked about it here, she doesn't know.
Yes, she says, I don't think.
I don't know. I don't think, I don't know, I don't know.
She says, I don't think, I don't know if that, and then she was interrupted. But you didn't feel it, I don't know. Yeah.
Okay. So you think you got that from the second interview, but you're not sure
Yeah, I'm not.
where you would have come up with
As I
that?
sit here right now, I'm not sure where I remember that from.
You talked about one of the other things that you considered was the fact that she had a relatively short labor, correct?
Correct.
How did you come up with the conclusion, doctor, that she had a relatively short labor?
Well, based on that she did not know she was in labor, and then she went into the bathroom and had the baby. But that's actually recently been called into some question because of, and I haven't really seen it, but I've heard that she may have been complaining of cramping at the Reds game and earlier that day. So I don't know if she had a short overall labor, but what I do know is that she had one push and the baby just plopped out. So that part of her labor was very short. But the overall labor, what we commonly call the first stage of labor, was time. At this point, all I can say was time indeterminate.
So can we disregard that then when you say she had relatively short labor?
We can, yes, we'll disregard. I don't know what she had on a relatively short labor. All I know is that she went to the bathroom, pushed the baby out on the toilet, it plopped out in a very short fashion.
One of the excerpts that you were provided?
I believe I was, and I've reviewed it subsequently. I can't recall where it is in the first or second opinion, if I mentioned that.
But if you have now heard that she started having cramps the evening of May 5th,
She may or may not have been in labor. It's hard for me to determine.
and that come the morning of May 6th and throughout the day, she was laying on a heating pad because the pain was getting more intense.
She may have been in labor. And obviously, since it resulted in delivery, may very well have been in labor.
And if her boyfriend provided testimony that she was squeezing his hand and he was trying to rub her back to help with some of the cramping, getting
Then
that back pain's consistent, correct?
that would be further evidence that she was in labor at that time.
And if she says the pain was in her back and it was piercing, we're transitioning along here, aren't we, to
Sounds
labor?
like it.
And if that started as early as the evening of May 5th, you have no reason to discount that, correct?
No.
You also made a statement that, in your report, that the short labor, which now is no longer short, was probably very easy because, again, we have a growth-restricted baby because of the small size of the baby, correct?
And the stillbirth.
But you talked about the small size of the baby, correct?
I believe so, yes.
Okay. As we sit here today, you have no idea what size that baby was when she came out of Miss Richardson, do you?
Other than I maintain my opinion to a reasonable degree of medical certainty, it had IUGR and growth restriction and was stillbirth.
So you assume that the baby was small at delivery?
Yes.
Okay. From the review of materials that you've looked at for preparation in this case, are you aware that Miss Richardson worked at Child Watch?
Yeah, I think I did see
Daycare?
that, yes. Mhm.
Okay. And we saw a lot of pictures today. She likes kids. Would you accept that as true?
I accept that as true.
She spends time with kids. She spends time with babies at work. You accept that as true?
I accept that as true.
I think at one point it was even said babies as young as 6 weeks she has experience with. Do you accept that as true?
I accept that as true.
You would agree that the only person, not just in this courtroom, but in this world, that has ever laid eyes on baby Richardson is the defendant?
That is true.
And she has experience with babies, right?
That is true.
In the second transcript on page 27, can you read line 10 to me? Skylar's description of her baby.
She was kind of big.
That's not small, is it?
I don't know what that means.
But she does, because she works with babies, correct?
I have no idea.
But did you review that part of it? Was that one of the excerpts?
I don't know where that was. I did read that, and I didn't think she would be able to assess, after 30 years of delivering a baby, I can hold them up and guess within a half a pound, but I wouldn't expect her to be able to guess the birth weight based on what the baby looked like.
Well, she didn't give a description of a small baby, did she?
That speaks for itself.
Thank you. Now, you didn't testify much about this today, but in your report you talked about this mammalian gag reflex, correct?
Incorrect.
You did not?
I believe it was a mammalian dive reflex.
Mammalian dive reflex. You talked about that in your report.
Correct.
And you said that there's no way this baby could have gurgled because she was dropped out into a toilet, right?
2 reasons they're not going to gurgle.
Go ahead.
Underwater. One is the mammalian dive reflex. If they go underwater, they're not going to breathe until they come out. And number 2, they have no air in their lungs to blow out and gurgle yet. There is no air in the lungs when the baby's in utero. So if the baby's born alive underwater, it's not going to gurgle. That was my rationale. Those 2 things.
Okay, well, we're going to go back to what you reviewed then. Doctor, what are you basing your statement on if the baby's born alive underwater?
I believe Carter asked her, did she hear the baby cry? And I believe Skylar said when she was in the toilet, she may have heard a gurgle.
Mm-hmm.
And I did not think that that was consistent with anything I've ever seen in 30 years where a baby gurgles upon its birth.
Okay, let me ask you a couple questions about that, okay? Where in either of the transcripts did it say the baby was underwater?
It was in the toilet. It was said they heard a gurgle. And my position was, A, had it been underwater, it would not gurgled because it wouldn't have breathed. And B, babies do not gurgle. They startle, they take a big breath in and start screaming.
Doctor, where in either of the transcripts did you read that the baby's head was underwater?
I didn't read specifically. I read the comment on gurgle and made 2 assumptions why that was unlikely to be true.
And both of those assumptions assume the baby's head was underwater.
No. The second assumption was that the baby would not have gurgled to start the transitioning to extrauterine life, because babies do not gurgle. They take a gas bin, they scream.
Were you provided the excerpt in the first interview where she said when the baby came out, she caught her head? She catches her head as she's coming out?
I believe it said she tried to catch it, but it happened too fast and it went down into the toilet.
Your Honor, may I approach? Line 12, I kind of caught her by the head a little bit. Do you see anywhere after that where it says she went down into the toilet?
There's another interaction where they talk about the baby being really slippery and fell into the toilet and stayed there for 2 minutes.
Doctor, I want to show you where they're talking about that in the second interview on page 19. Was her head part under the water? I don't think, no. Where does it say that her head went under the water?
When I was looking at it, Carter asked the question, were there bubbles or anything? Sometimes there's like bubbles. That meant that line of questioning was trying to determine if Annabelle was underwater. And it may have gurgled. And the questioning was, did this baby gurgle or not gurgle? And so my argument was that A, had it been underwater, and we don't know because we weren't there, had it
Correct.
been underwater, it wouldn't have gurgled because they don't gurgle underwater due to the mammalian dive reflex. And 2, it wouldn't have gurgled because that's not what babies do when they're born.
So the fact that she used the word gurgle, she didn't pick the right word, is that what you're saying?
Well, that word was prompted by the detective. She followed up and said gurgled, and my opinion was the baby didn't gurgle.
And she's told us the baby's head didn't go underwater, correct? 2 times.
She said she tried to grab the baby slipped into the toilet, and she may have heard a gurgle.
That's different than you saying she said her head went underwater.
I don't know if I wasn't there. I don't know if the head was underwater. I'm saying the baby didn't gurgle.
I understand that, doctor, but you would agree, you just said in the interview transcript, it said her head went underwater. Do you recall reading that?
I thought no, I thought you said she grabbed it by the head, and I said she tried to grab it by the head and it slipped into the toilet. And there was a question if the head was underwater, and she thought upon questioning, she thought she may have heard a gurgle. And my point was, I did not think it would be reasonable that she would hear a gurgle, because had it been underwater, it wouldn't have gurgled due to the mammalian dive reflex, and 2, babies don't gurgle.
Doctor, what if the baby wasn't born in the toilet?
Then that's an unknown. We don't know how that would have changed. It would have still been stillbirth if it had been on the floor.
Very early in on your direct questioning, Mr. Rickers asked you your opinion in this case, and you said, yes, I have an opinion. Indeed, on May 7th, she delivered a stillbirth infant in the bathroom.
Correct.
What if that baby was not born in the bathroom or in the toilet?
then it would not been delivered in the bathroom or the toilet.
Would you have wanted to know that before you wrote a whole paragraph about the mammalian dive reflex?
That was due to answer the question in my mind of, did she hear a gurgle, which was used by some to say that was a sign of life. And what I was saying is, I don't think that gurgle can be used as a sign of life. That was my point.
Gotcha. Would it be safe to assume if you did not review Dr. Andrews' recorded interview to the police, you also didn't review Dr. Boyce's recorded interview to the police?
Correct.
Are you aware that Dr. Boyce, well, I'm sure you're aware from the review of the records that Ms. Richardson met with Dr. Boyce. She had her appointment with her before the investigation started, correct?
On July 12th.
You're aware of that?
Yes.
So before she's ever questioned by any police officer, you're aware that she told, or are you aware, I guess is the proper question, that she told Dr. Boyce that the baby was born in the bedroom?
I don't remember if that was in the medical note that I reviewed. I just remember her telling Dr. Boyce that she delivered a stillbirth at home and then buried it in the backyard. But I don't remember, it could be there, I don't want to argue, but it may or may not be there. I don't remember seeing bedroom.
And you don't recall watching Dr. Boyce's interview and hearing her tell the police that
I
that's
didn't,
what
no,
happened?
I didn't see that.
Okay, you didn't see that. When the defense gave you excerpts to review, did they give you any excerpts where she talked about indications of a live-born baby?
I believe there were the experts, the comments from the 20th interview. There were comments she made of maybe saw a movement, maybe saw a gurgle, maybe saw the chest move. I did have those when I first evaluated, and then got the full, like I said, got the full transcript later.
Okay. So you were provided with excerpts about the baby moving?
From
Gurgling.
the 20th interview, yes.
Gurgling, but
I've
you
had
don't-
all that, yeah, I've been able to.
You've seen that?
Mhm.
You've disregarded all of those, correct?
I wouldn't say necessarily disregard, I weighed them against the 14th interview and what she said early in the 20th interview when she says she didn't feel movement and came out very pale and she didn't think it was alive. And then I grant you later on in that 20th interview, there were some suggestions that maybe she saw a movement or saw a gurgle or heard a gurgle.
Movement, that was irrelevant to you?
It wasn't irrelevant. I had to weigh it all. I had to weigh it to come up with a conclusion of, was my medical opinion that this baby was born stillbirth, which means no sign of life, was that a valid opinion? And I used all of that information to come to a conclusion.
You would agree that crying, gurgling, moving limbs, those are all signs of life, doctor?
Yes,
Those are not indicative of a stillborn child?
yes.
Mr. Kraft, I apologize for interrupting. Ladies and gentlemen, I think we're going to take our afternoon break. Remember the things that I previously told you. Do not begin to think about how this case should be decided or begin discussing the case amongst yourselves. We'll see everybody back here at 20 after.
And we are at a break with Dr. White's testimony once again. And as I've stated in chat, the prosecution is doing whatever they can to match what the defense did in earlier testimony. What am I talking about? I'm talking about the fact that somehow the defense was able to discredit Dr. Brown's expert testimony and done it well. Here, on the prosecution's cross-examination of Dr. White, it's like they're digging and digging and digging to try to discredit Dr. White and failing miserably. It's like they're trying to find that secret treasure and coming up with nothing but sand. Baby Kisses is calling the state out on this versus her Charlie Brown reaction. Then she goes on to say, shame on the state. And then let's see, goes on with that, and then she agrees with everything I just said just moments ago. Oh, all I'm saying right now is Dr. White is holding fast and firm to everything he's testifying to. He is not getting flustered. He is not getting rattled, and the prosecution trying to discredit this medical expert, an OBGYN expert. It's falling flat. So if anything, they're gonna need to rely on the rest of the testimony that's coming up throughout this week, which will include Alan Hirsch, Leanna Lyons, Chris Curry, Ashley Brown, psychologist Dr. Stuart Bassman, Tracy Relic, Brooke Skylar Richardson's brother Jackson, Annie Campbell, and forensic pathologist Mark Levon and Joe Danzer to help rehabilitate the case through cross-examination. Because at this moment, it's not looking good for the prosecution. So we're gonna go ahead and get back in the courtroom. We're gonna finish this testimony off, and we're gonna call it a day.
You may be seated. Ladies and gentlemen, welcome back. Was everybody able to follow my instructions and admonitions over the break?
Yes, sir.
All right, Ms. Kraft, you may continue.
Thank you.
Now, Doctor, I think where we left off is I had asked you about some statements that the defendant had made about her daughter, the crying, the gurgling, moving her limbs, and I asked you if those were all signs of life, and you agreed with that, correct?
Yes.
And that those indications, those statements that she made are not indicative of a stillborn child.
Yes.
And you would agree, based on her life experiences, she's probably more experienced with signs of life than signs of death?
Yes.
But you still didn't have any statements she made indicating a live birth to come to your conclusions, correct?
I believe I said I weighed those in the overall picture.
You weighed those in the overall picture. Okay, well, I want to talk to you about a few more of the statements that you took into consideration in reaching your diagnosis, okay? You talked about a few things. I believe on direct, I want to make sure I get it right, your exact wording was she described her daughter as really white. Do you recall saying that?
Yes.
Same question I've been asking you. Do you recall where you saw that in the transcripts?
On my page, it was page 22, after asked by Carter the appearance.
On the second interview then?
On 7/20.
On 7/20. And where was that at, you said?
Well, on my, I don't know if the transcripted copies are all the same, but it was I think it was the bottom of page 22. She's asked about the appearance. It says really white, I think.
And you said you believe that was on page 22, when she was asked about the appearance?
I believe that's what it was.
Your Honor, may I approach?
You may.
Judge, just for clarification, we've had, I think, 2 different transcripts of what's going on. Am I correct about this?
They change page numbers based on edits.
Your Honor, if I may. And I'm going to show page 16, which I believe is the conversation.
Okay.
Okay, thank you.
Okay, go ahead.
Doctor, I want to show you page 16 in the transcript from July 20th. Is that the conversation you're referencing? Because everybody's correct, the pages are off a little bit, we have to do some edits.
Yes, I believe that's what I was referring to.
That's the conversation you're referring to. And your recollection and what you testified to is that she, and what you based part of your opinion on is that she described the baby as really white.
I thought it said really white. That transcript says white, I think. That's possible, a memory issue.
Doctor, you would agree on line 3 that Detective Carter asked when she came out or after, I'm sorry, line 6. So did you, I apologize, I'm looking at something else we're going to talk about a little bit. Line 10, and what color was she when she came out? What does that say?
White, I think.
Not really white, correct?
Correct.
It's not even definitively white, is it?
Correct.
Well, they're all white because they've got sticky, goopy stuff on them. What about like her fingers or whatever? Were they pink? Were they red? Were they? I don't remember. You agree that's what it says?
Yes.
Is there anything in there that definitively says this baby was really white when she came out?
If there's no other, this does not, correct.
And if I represent to you, that's the only reference we have in anything in this investigation as to color of the baby. You would agree we don't have anything definitive on the color of the baby.
I believe you if that's what it says white, I think.
But you based your opinion on that. You took that into consideration, correct?
Correct.
We've already talked about, you said in your report, one of the other things you looked at was the fact that there were low amniotic fluids
Correct.
because there was no gush.
Correct.
And we
She
talked
does-
about,
And she doesn't remember water breaking.
so we don't definitively know that the baby was really white, and we don't know if she knows if her water broke or how much came out, correct?
Correct.
You also made a statement when you talked about her appearance, when you said the things that you took into consideration when making your determination that baby Richardson was stillborn, that she was really white, and that her cord just snapped in two. And then you went on to say the baby's cord was around her neck and it snapped from the placenta.
And I believe I said it was detached when asked about using the word snapped. So I believe I said it was, maybe it wasn't, I believe I agreed that maybe it wasn't snapped, but it was certainly detached from the placenta when it came out.
Well, I wrote it down when you said it because the word caught my attention. You do not recall telling them on direct that the cord just snapped in two
I do remember that, and then I think I corrected myself.
and said that it detached.
It was detached. It was no longer attached. The umbilical cord was attached to her umbilicus, or what we call belly button, went up around her neck a little bit, and was not attached to the placenta. So it came apart.
And what significance do you attach to her statement that the cord was around the baby's neck or up around her neck?
Well, the reason why that's important is babies who have what we call nuchal cord around the neck, especially if they're growth restricted, have decreased amniotic fluid.
Well, we don't know if we have decreased amniotic fluid, correct?
But
if we did.
If we did.
Okay,
Yeah,
go
if
on.
if we did, that cord was tight around the neck, enough around the neck that when she delivered down by the toilet and she tried to catch the head, the cord, so now you have a part of the cord attached to the placenta in the uterus, part of the cord attached to the baby, to the umbilicus, around the neck, but those two are not connected. That cord came apart during that process. Babies with IUGR have very small, not very healthy umbilical cords, and that's much more likely to happen, along with the possibility that I didn't, other than saying it was stillbirth, I didn't say that it was an actual cord accident, but one of the causes of cord accident in a stillbirth is a cord accident from that cord being wrapped around the neck real tight that you wouldn't be able to know unless you were monitoring the fetal heart rate during labor.
Which nobody was doing.
Correct.
Nobody was there.
Correct.
You weren't there, Dr. Andrew wasn't there, Dr. Brady wasn't there.
Correct.
She didn't call her parents, she was there alone.
Correct.
So nobody was monitoring this baby.
Correct.
And all those things that you just said, if we had this, we don't know if the amniotic fluids were low because the defendant doesn't even know, correct? Correct.
Correct.
We don't definitively know what color the baby is at this point, correct?
Other than what was said, and I thought it said,
Well,
I
you
thought
based
it
your
said-
opinion on it being really white,
yeah,
correct?
well, it says white.
I think. I don't know.
Okay.
And now we've got to factor in the cord being wrapped around the baby's neck, correct?
Well, that was just a description.
Doctor, July 14th interview, where you provided the transcript, and this isn't her talking to the detectives, any of the detectives, okay? And I'm going to represent to you that Mr. Richardson is the defendant's father, okay? Okay?
Yes.
Line 13, was the cord wrapped around its neck or anything? Line 15, Skylar. No. Were you provided that excerpt?
Yes.
Did you choose not to attach any significance to her telling her dad that there was no cord wrapped around the baby's neck?
I chose not to use a cord accident specifically with a nuchal cord as the reason for the death because there was conflicting information.
Conflicting information, okay. But you did want to talk about a cord abnormality and it snapping in two, correct?
Well, because I think that was I think that states in those interviews that it was detached.
This is back in the January 14th interview, okay? Or I'm sorry, July 14th. apologize. Your Honor, if I may have one moment here. This is the January 14th interview, Doctor. Lieutenant Payne asked her, "Can you remember whether or not she still had the umbilical cord attached to her belly button?" "I don't remember."
Well, but we knew earlier it was wrapped around her neck and not
Well-
attached to the placenta,
She told her
I-
dad it wasn't wrapped around her neck.
or up around the neck.
She told her dad no.
Well, she said, I thought to Carter that it was up by the shoulder near the neck.
So you agree, on the 14th it's attached to the baby, right?
I'm sorry?
On the 14th, she has it attached to the baby, correct? Umbilical cord attached to her belly button. I don't remember. It's not detached from the baby, correct?
The umbilical cord was not detached from the baby.
On January 14th, or July 14th.
It was disconnected from the placenta,
From the placenta.
and part of it was up by the neck or the shoulders.
On January 14th, it's attached to her, no cord around her neck, correct?
I understand, we're reading the same things.
It's not detached from her on July 14th, correct?
I never said the umbilical cord was detached from her.
On July 20th. So it still would have been attached then to her. Maybe. I don't think it was attached to her.
The placenta, umbilical cord, baby were not all attached together is my point.
You would agree those statements are not consistent with each other about whether or not it's attached to the baby. That's my first question.
I don't agree with that.
Okay.
Meaning the placenta was not attached.
Do you recall she made a lot of different statements about the cord and the placenta?
There were different statements about the cord and the placenta.
I'm sorry?
There were numerous statements about the cord and the placenta.
Your Honor, if I may have a moment.
Okay.
You agree with regards to the placenta, she made different statements about the timing of when it came out?
Yes.
She initially says it came out the next day,
Correct.
then she says it came out with the baby,
Once she was off the toilet.
then she says,
She said she delivered the baby on the toilet,
well, that's what she says.
and she said, I believe, that it came out somewhat later, and then she buried it with the baby.
But originally, she said it came out a day later, correct?
Correct.
Which is not consistent with it coming out with the baby.
Correct.
You would agree you're attaching a lot of significance to her statements that keep changing about where the cord was located, what it was attached to, when the placenta came out?
I'm weighing them all.
And you're weighing them all in favor of this being a stillborn baby,
Correct.
even though she can't tell you the color of the baby, correct? Not definitively, it's not really white like you reported.
Correct.
We don't know whether or not there was a gush of fluids or not.
Correct.
We don't know if the placenta came out the day before or the day of or at the same time.
That is a correct statement.
We don't know if the cord was attached to the baby or attached to the placenta, or if it snapped in two for that matter, correct?
It was a part. Part of it was attached to the placenta, part of it was attached to the baby up around the shoulder.
And you're standing firm, you believe her when she says it's up around the shoulder,
Yeah, that's what I read.
even though she tells her dad, not a police officer, it was not.
Yes, I read both accounts.
So you pick and choose which ones you choose to believe to support your diagnosis of stillbirth, correct?
I use what I think is pertinent, most consistent with my understanding of the medical aspects of this case. I use them all to formulate the opinion because there was a wide variety of information. I had to make some assumptions on what I believe to be true and not true.
So your report is based on assumptions about what you believe is true and not true?
It's based on my review of all the information I had, based upon my ability to assess with a reasonable degree of medical certainty how Annabelle died.
You don't know the defendant.
No.
You don't know her propensity for truthfulness.
I read the medical records and her history, but specifically I've never interacted with her.
You only know what information she chooses to share.
I only know of her what I read in the medical reports and reviewing the interviews on the 14th and the 20th and the audio tape and a little bit of the video.
Did you read the transcript where her own parents couldn't tell whether or not she was telling the truth?
Yes.
Did you discount that as well?
No, teenagers do tend to lie and not always tell the truth, so I took that all into account. And she didn't want to tell her parents well, she didn't even tell her parents she was pregnant, so she didn't want to tell her parents the truth.
That's a pretty big lie, isn't it?
That lie happens every day.
Babies being concealed for 9 months,
Yes, it happens.
births occurring in
In the
bedrooms
U.S.
upstairs,
In the U.S., it happens every day.
bodies being disposed of in the backyard.
That doesn't happen every day.
No, it
That's the
doesn't,
first
Doctor.
I've heard of that. But I have heard of them being discarded in trash cans and firehouses and that kind of thing. But they are discarded.
Babies are killed and discarded, correct?
Correct.
And I apologize, doctor, I was having trouble finding it, but the July 20th interview. Detective Carter on line 22, so it still would have been attached to her then? Line 24, Skylar, maybe. I didn't think it was attached to her. Was it still attached to the placenta? Do you remember? No, I don't remember. It might have been. That doesn't say it was detached from the placenta, does it?
In that space, the first question was the question of did she cut the cord? and she says she did not cut the cord.
Correct?
The two options for the placenta being delivered, one was the next day, which I didn't think happened, but happened later when she fell off the toilet and got off the toilet.
And again, you're assuming that she was on the toilet,
Correct.
and you're assuming the cord was snapped in two,
Came apart.
and it broke off from the placenta. Correct?
The point is that the umbilical cord is a certain distance, was not attached to the placenta, was attached to the umbilicus up by the shoulder.
Were you there that night, doctor?
No,
Did you see a cord wrapped around baby Richardson's neck?
no.
She told her father it wasn't. You disagree with that?
It was up by the shoulder. It could have been
Says
around.
who?
I thought we went over that earlier where she said that to Carter.
No, I showed you in there where she told her dad it was not.
But I thought before that you showed me where
I
she.
did not.
Let's move on, Ms. Krabs.
You definitively say that the cord wasn't attached to the placenta. What does Skylar say?
Skylar says no.
Can you read line 12 and 13, please?
I don't remember. It might have been.
Attached to the placenta. And you weren't there, correct?
Correct.
So you only know what she wants you to know, correct?
I only know what I've reviewed in both interrogations and the entire medical record.
And you reviewed this part of the interrogation, as you want to call it, where she says it might still have been attached to the placenta.
I see that, yes.
You disregarded that one too? Didn't attach much weight to it?
Weighed it all, yeah.
There's only so much length to that cord, isn't there, doctor?
Correct,
It can only stretch so far, correct, doctor?
correct.
In a typical delivery, you're there easing that baby out.
Correct.
Doctor, I'm going to go back for a second. You said the final thing that you made your decision about this baby being stillborn on was her weight after her pregnancy. Correct?
That was one of the things I stated,
Her post-pregnancy weight.
yes,
Usually takes several months for women to get their post-pregnancy weight off, correct?
yes.
Were you aware that in the days preceding her pregnancy, she was already resorting to the use of laxatives?
No,
Do you know what the phrase bossing it up means?
no,
Based upon everything we've just discussed, we no longer have a definitive fundal height. We now have a new conception date. We don't have a really white baby. We don't know what her fluids were at. We don't know whether the cord was attached or not, or what it was attached to. You're still going to stand by your diagnosis that this baby had intrauterine growth restriction and was stillborn?
yes, ma'am.
Nothing further, Your Honor.
Mr. Rickers, redirect.
Yes. Doctor, you recall from, evidently you have a great recall on the transcripts that you've read. Seems like you know page numbers and all that. Do you have a photographic memory or something?
No, I did well in school, got a pretty good memory.
So doctor, let's talk about this cord and try to put this to rest. Do you remember in these transcripts where Skylar was asked at least 2 times by Detective Fain in that first interview whether she cut the cord?
Yes.
And what was her answer, if you know by you remember?
No.
And that's significant, isn't it?
Yes.
Are you aware that she didn't even know what placenta was during that first interview?
I do recall.
Let me help you, son. I'm sorry to interrupt. Do you remember when Detective Carter in the second interview said, well, what happened to the placenta? You know, it looks like a big thing of hamburger or meat. You remember that?
Yes, I do. That's why I don't have a photographic memory. I didn't remember it till you told me.
Well, so she didn't really know what the placenta was from that statement. Is that correct?
Correct.
So, based on the fact that she didn't have to cut the cord, which is not in dispute, is it?
Correct.
And I'm talking about from the transcripts. Does it matter that whether the cord was maybe slightly around her neck or whether it was maybe attached to the belly button or maybe attached to the placenta? Does that matter?
No.
What matters is that she didn't have to cut the cord, correct?
And you know, the evidence shows a sequence of events consistent with a stillbirth.
Doctor, Ms. Kraft was talking about Dr. Boyce and what she may have said or did say or whatever. I'm going to put on this, is this up? Ready to roll?
Objection.
Council approach. The objection is overruled.
Before we talk about this, which is a page from Skylar's OB visit on April 20, on July 12th. Correct me if I'm wrong, but are medical charts where you as a doctor or you're a medical assistant puts things into that chart, how important is it to be accurate when you put things in a patient's chart?
It's very important.
Is it important because, one, because you're going to rely on that chart later on when you're treating that patient?
And it needs to be honest and factual.
And does it also help you defend yourself if unfortunately you're sued for medical malpractice?
Correct.
And just so everybody's clear, let's talk about this that's on the board. This is from Dr. Boyce's notations in the chart. Do you see anywhere where she says anything about bedroom or anything like that?
Not in the note.
Okay. She said she delivered the baby on May 7th, stillborn. She did not tell anybody. Is that, you remember reading?
Yes.
Great. Dr. Ms. Kraft went into a lot of stuff about suicide and what you all do if you're in fear of the patient committing suicide and stuff. We all heard from Dr. Andrew about Skylar's surprised reaction to Dr. Andrew telling her that she is pregnant. And you're aware of that reaction.
Yes.
Dr. Andrew provided an affidavit in this case when we were doing pretrial motions and stuff, and I'm going to put that on the board.
Objection, Your Honor.
The objection is sustained.
May we approach?
You may. Continue, Mr. Rickers.
Dr. Andrew, Dr. White, I apologize. Were you aware that Dr. Andrew, during the third trimester of a woman's pregnancy, all his patients, he always talks to his patients about depression and postpartum depression. You aware of that?
No, I wasn't.
And are you aware that had he thought that Skylar, after that visit on April 26, was going to harm herself or her baby, he would have taken further steps? Were you aware of that?
No, I'm not aware of that. He would have been ethically and the standard of care as you would have to.
So that makes sense.
Yes.
Have you ever known in obstetrics a doctor to do a fundal height measurement for the chart without actually measuring that fundal height with what you guys use, that piece of tape?
You cannot.
And you're aware from the Hilltop records that he put in there that he measured 32 centimeters. Is that correct?
That is in there, yes.
And that's part of what you...
That's part of it, yes.
You're also aware that he did an ultrasound while she was there on April 26?
Yes.
And was he looking for amniotic fluid?
Objection, Your Honor.
You will answer if you can.
He did not measure the amniotic fluid.
Did he measure the femur?
There's no record that, there's no record that he measured the amniotic fluid. There's no record that he measured the femur.
And had he done those things, would that be in the record?
Yes, if you do a ultrasound, you're to record and take an image and document all your findings that you do.
Doctor, Ms. Kraft asked you about that second interview about signs of life that they claim was stated by Skylar during that second interview. And if I heard you correctly, you said you did take that into consideration. Is that right?
I'm sorry, can you
I
ask me the
apologize.
question again? Yeah,
Did you saw that interview?
Yes.
You saw the entire interview.
I read, yes.
And you, Ms. Kraft said you discounted those statements about gurgle. Why did you discount that?
Well, I didn't discount it. I waited in coming up with my opinion on the basis of if I thought was medically plausible or not.
Did you remember whether the word gurgle was first used by Skylar or was it used by the police?
It was used first, and I don't remember who used it first, but it was used first by Detective Fain or Detective Carter.
And do you remember whether it was used several times before they finally got her to say that the baby gurgled?
I don't remember the number of times.
Fair enough. What about, did you take into consideration that she said she cremated her baby?
I read all of that and I weighed that in determining what responses were reliable and what were not.
Is it possible to, how much, a baby is what, 75, 80% water?
Yeah, that's a good number. Yes, 75%
Is it possible,
water.
based on your expertise in the medical field, to light a baby on fire with a lighter put to the foot?
Objection, Your Honor, beyond.
Sustained.
Well, let me ask it. If it isn't possible to light a baby on fire by putting a lighter to it, would you discount that fact?
Objection, Your Honor.
I will sustain the objection to the scope. The jury will disregard the question.
Let's talk about Ms. Graff talked about measurements, and one of the measurements was this fundal height measurement of 32 centimeters that Dr. Andrew actually took, correct?
Correct.
Is another measurement the possible date of conception?
Well, that's how if we have a known date of conception, in my practice, it's usually infertility patients that have in vitro fertilization, but if you know the date of conception, that's about the most reliable way to come up with a estimated due date.
So it was an important fact to you in coming and arriving at your opinion that Trey Johnson, the father, said that he and Skylar had sex either the last week in July or the first week in August, correct?
Yes.
And that's how you arrived at 39 weeks gestation when Skylar had that first visit with Dr. Andrew, correct?
Correct, using the latest date possible,
Which was August 5th.
being August 7th.
Okay, August. Well, let's use the conception date that I believe you may have originally used based on the anthropologists.
Correct.
Let's use that. That was, I believe you said August 21.
Correct.
So using that, giving the prosecution the benefit of the doubt, using that date, when Skylar was seen on April 26 for her first OB visit, Dr. Andrew, how far along was she?
So if her conception date was August 21st, first day of her last menstrual period was August 7th, subtract 3 months, add 7 days, makes her due date May 14th. You subtract 14 days in May, 4 days in April, 18 days prior. So she would have been 37 weeks and 3 days.
And so using that and using Dr. Andrews' measurement, in fact, when he did this sonogram, he kind of guessed at 32 centimeters, as I recall, correct?
He just did the fundal height at 32 centimeters and looked at the baby and thought 32 weeks was a reasonable subjective guess.
Doing the sonogram.
Doing the sonogram.
But in fact, using the date of August 21st, she was 37 weeks plus a couple days.
Yes.
So that would place her 5 centimeters off, is that correct?
Correct.
And that is an issue, isn't it?
Yeah, that would be a positive screen for intrauterine growth restriction.
Doctor, Ms. Kraft showed us all Skylar's statement that white is the color of the baby. White, I think, is what I think we saw, all of us. Well, she didn't say the baby was purple, did she?
No.
Did she say anywhere the baby was pink?
No.
She just said white, I think.
That's what I read, yes.
And that's why you relied on it, correct?
Yes.
I don't want to belabor belabor the point here. You and I spent some time when I first questioned you about this bulletin from ACOG, the American College of Obstetrics and Gynecology, right?
Yes.
And not only you, but Dr. Brady, when he was in here Friday, both of you said that obstetricians and gynecologists rely on ACOG, right?
Yes.
The date of that is 2013, reaffirmed for 2018, correct?
Correct.
And Ms. Kraft was questioning you about the medical book that you rely upon, and she pointed out a 1991 study, as if to say that fundal height measurements are only 40%
she didn't want to tell her parents well, she didn't even tell her parents she was pregnant, so she didn't want to tell her parents the truth.
That's a pretty big lie, isn't it?
That lie happens every day.
Baby's being concealed for 9 months.
Yes, it.
Put in there that he measured 32 centimeters, is that correct? Says something different than what Ms. Kraft is trying to pull out, and that is that fundal height measurements are 65 to 85% reliable in determining whether a baby is growth restricted.
65 to 85% sensitive, which means how many percentage of abnormals you will pick up by a positive screen. Specificity, which means that 96% of normals will be measured as normal.
So the part in the medical book that Ms. Kraft was showing, that's old news.
It's in variance to this.
And it's old
older.
news.
Yes.
And it's not to be relied upon.
I don't. Yeah.
Thank you, Doctor.
Ms. Kraft?
Doctor, I want to make sure I just heard you correctly. You don't rely upon a book that you cited as pertinent literature reviewed in the report that you authored on this case?
In this particular instance, I relied more on the updated information than the 1991 study.
Williams Obstetrics Textbook, Volume 17. That's your report, correct?
Yes.
That's Volume 19. It's even more recent than what you relied upon, correct?
Oh, then I don't know if that's in that book.
You don't know if what's in that?
I don't know if that study would be in Volume 17. They do change.
They do.
I
And that's a more
assumed it
recent
was
book.
Volume 17.
No, we went more.
Then I
current.
can't make any statement about Volume 19. I have never reviewed Volume 19.
But you do agree that we should go with current literature?
But I didn't utilize Volume 19 for my review.
You went even older.
And the point is, I used the updated ACOG information.
What is that section titled?
Screening for fetal growth restriction.
What does screening mean?
Means identify those who are at high risk to have the condition.
And if you do a screen with fundal height, it then talks about ultrasound diagnosis, correct?
Correct.
To assess for fetal growth restriction, 4 biometric measures are commonly used. Number 1, biparietal diameter. Number 2, head circumference. Number 3, abdominal circumference. And number 4, femur length. We don't have those in this case when baby Richardson was alive, do we?
Correct.
And if you suspect, based on your ultrasound or your fundal height, because they're only screening tools, right, doctor? You start performing them every single appointment after 24 weeks, correct?
Is that something I got in?
Answer if you can.
Now, I'm sorry, what was the question?
Well, I'm taking it from there, and I'm taking it from your direct testimony that when we first started this afternoon, at 24 weeks, if you've got a concern, you're doing a screen fundal height every single appointment, correct?
No. That's not true.
Doctor, did you not say in the very beginning of your testimony on direct examination, when you have concerns of a growth-restricted baby, after 24 weeks, you measure the fundal height with the tape measure at every single appointment?
I said you measure the fundal height at every single appointment. That's not what I understood your question to be, though.
Because you need to determine if the baby is or is not growing
At-
along the natural curve.
We measure the fundal height at every visit, which is every 4 weeks.
Because even you said you can't definitively say off of one single measurement what that baby's doing.
In the setting of what Dr. Andrews had on April 26th, he could not say.
You could not say, correct. And doctor, one other thing, this ACOG bulletin that we keep wanting to talk about. The purpose of this ACOG is guidance for management and timing of delivery on babies that have been diagnosed with IUGR, correct?
Correct.
We're not even at the point of having a diagnosis on this baby. I want to do some simple math with you, doctor. Let's assume, for sake of argument, even though you've already said, and I want to be clear, you were not given either interview of Dr. Andrew or Dr. Boyce to review, correct?
Correct.
So if Dr. Andrew says in his interview that he used his hands, you don't know, you weren't there, you can't have an opinion on that, correct?
I've stated my opinion that he measured a fundal height in centimeters.
I understand that, but if he is
I
saying
think
he
we've been
used
over
his,
this issue. Let's move on.
let's assume for sake of argument, we do have a 32 centimeter measurement on April 26th. You yourself said during direct examination that can be off by 3 centimeters, correct?
Correct.
Now we're up to 35 centimeters. You would agree with that?
No, it means that if you measure a fundal height at 32 centimeters and the baby is normally grown, the fundal height would be between 29 centimeters and 35 centimeters.
So it could be up to 35 centimeters, correct, doctor?
The fetus could be up, if it was normally grown, could be up to 35 weeks gestation.
Okay. So it is possible that on April 26th, baby Richardson was 35 weeks gestation.
It's possible, well,
Yes or
baby.
no, doctor?
Yes. No, it's not possible. Because we know what her fundal height was, and she was 37 and a half weeks at that visit. You
No.
asked, was it possible? I said no.
You're assuming that her fundal height was 32 centimeters definitively on that date, correct? That's your assumption.
If, I thought you asked a question with the assumption her fundal height was 32 centimeters.
And based on your testimony that that measurement can be off by up to 3 centimeters or 3 weeks, it is possible that on April 26th, she was at 35 weeks gestation, correct?
It's not possible,
It,
because we know her gestation at that point. And she was between 37 and a half weeks and 39 and a half weeks.
and that's your assumption based on your new conception date?
Even the old conception date would put her at 37 and a half.
Doctor, you've changed the conception date to better fit your narrative, isn't that correct?
No, I changed the conception date based on the information in the police report, when they interviewed Trey Johnson.
That you did not have when you did that second report.
I disagree with that. I think I would have left it at the original due date of May 14th had I not. I would have not changed it had I not had the information that the conception occurred between July 24th and August 7th. That was the information that I had to change her due date to May 1st.
Because every doctor includes everything in their records, correct, doctor?
That was in no medical record.
It wasn't in your report either, was it?
I-
And certainly, if that document meant that much to you, you would have listed it in your report,
Shouldn't
correct?
even allow them to answer.
Go ahead and answer if you can.
Correct?
At some point, I received that report and changed the estimated due date based on that interview. I do not recall the exact date I received that information and where it was and when I amended my report, but I can tell you I would not have, I was very comfortable with the original May 14th due date until I received information to change it.
Even if it contradicts what both of the people that were engaged in the sexual act that resulted in the birth of baby Richardson would testify to.
I believe we've covered that that would make me go back to thinking her due date was May 14th.
Doctor, you have testified to several times now. You had Dr. Brady's reports and excerpts that the defense chose to provide to you when you authored your second report, correct? Yes or no, doctor?
Well, if this is my second report, I'm sorry, my second report does not include the new information. You led me to believe that my second report included the new due date, but evidently under two, it's not, because I said she delivered between 38 and 40, with the average being 39. So that was my recollection, that I received that after that, and then changed my due date estimation based on the police report.
Doctor, your estimation for the due date of August 21st was contained in your first report, correct?
The conception date of August 24th, the due date of the 14th of May
Was your first report,
was my first report.
based on scientific examination of the bones.
Correct.
You then received nothing else, including the police report, and you changed the conception date, correct?
Correct. Based on what I knew
And there's
from the
nowhere-
police interview.
You didn't have the police interview.
But that occurred subsequent to that second report. That's why it's not in that report.
You're saying you don't have anything in this report about the conception?
That, can I see it, please?
Sure.
What exhibit number is that?
It's a defense exhibit, I don't know what it is. I
What's the
don't-
date of the report?
It's the second report.
Thank you.
This report clearly says that the fetal gestational age at time of delivery was between 38 and 40 weeks by femur length. which was referring to the Murray forensic pathology report.
Correct.
I did not know, because I had not yet received the sexual history, to change it. That was subsequent. Further on, I said, had Skylar Richardson or doctor known on April 26th that she had been pregnant for approximately 37 weeks, that would have been a high-risk pregnancy, and say and I say in number 4, a 5-centimeter lag in fundal height at that gestation is significant and highly suspicious for IUGR in this clinical setting. And I stand by this report, only to change when I found out the sexual history, which is why I moved the due date to May 1st.
And you found out the sexual history subsequent to authoring that second report.
Correct.
You agree the first report says a conception date of August 21st.
Ask and answer, Judge.
Sustained.
This is your report, Doctor, correct?
Correct.
Likely conception occurred in late July 2016 when nobody is having sex. How is that possible?
It is not in July.
Thank you.
Thank you, doctor. You can step down. Ladies and gentlemen, I have been advised by the bailiff that we can stay as late as 5:30. Is that, I see general nods of heads, and the attorneys tell me that we can get at least one more witness in that time. We have one bit of technical issues that we have to get set up for our next witness. So, Mr. Mullins, if you could take the jury out. It's not going to be a long break. It's going to be about 5 minutes, and we're going to bring you right back so that we can get this set up.
Hey guys, this is The Last Outlaw saying thank you to all of you who watched this video and subscribe to BETHEA'S BYTE Reloaded, your drama-free true crime destination. I couldn't dream of doing this without you, so thank you. Did you enjoy this presentation? Are you looking to get more information on everything presented here? Are you looking to give more feedback on this presentation? Here's what you can do. Like this video. The more eyes on this video, the more this information is spread to others, which brings us a step closer to justice served. Share this video to your social media. Just like dropping a like, the more eyes on this video, the closer we get to justice served. Drop me a comment, whether it's on the topic or the presentation. I am open to all comments, whether it's a theory, a speculation, or a suggestion. I will respond to all. If you haven't subscribed yet, what are you waiting for? Hit the subscribe button to show your support of this little true crime engine, powered by you. Set the notification bell to all for future videos. Be sure to follow BETHEA'S BYTE Reloaded all over social media. At BETHEA'S BYTE Reloaded True Crime on Facebook. At EKB316 on X, formerly known as Twitter. At BETHEA'S BYTE Reloaded on YouTube. At EKB316 on Instagram. At King of Hearts 316 2021 on TikTok. You can drop me an email as well. The address is kingofhearts316_09@outlook.com. This is your home for news without the drama, where your opinions matter, for lively debates, where your voice is heard, and above all else, justice served. This is BETHEA'S BYTE, and it's reloaded.